There's Aaron.
Super guy. There's Aaron.
Yeah.
Married a super fella.
Hi, Aaron.
Who is that on the lower left there?
Constance. Hello, Constance.
Oh, hi, Constance.
This is my first meeting.
Oh,
Right.
glad you could join us, Constance. How did you find out about us?
Through a friend, Chuck Brandt.
Oh, that's right. Right, we connected. Right, fabulous.
Yeah.
Who are you?
I'm Lynn Rupi, and I co-lead
You're
with
Lynn?
Tim.
Okay, hi,
Yeah,
Lynn.
and Tim and Donna are.
I'm Tim. I'm
right.
Tim up here.
And
Yeah,
but I'm no leader.
Yes, you are. You're a fierce leader.
She's my leader.
It sure is.
Oh, Amy, you got the note?
Oh, there's Amy.
Amy, that's Lynn just above you on the screen.
Hi, Amy.
I
How
think
do you
it's
get
bringing speaker.
muted?
Yeah.
Can you unmute her, honey?
Pete.
Working on it.
Thanks.
Peter, do you have me?
Who is this? I missed.
Melody.
Constance
Melody
is
in the middle.
speaking.
Melody.
Melody at the X.
Melody.
Yeah.
Melody's in the center square right now.
Yeah. center square.
Okay.
X.
Oh boy. Oh boy.
Quite a Brady Bunch, isn't it?
Amy, I'm Tim, and that's
Hi.
Lynn
Hi.
just above you.
Yeah, I'm glad you could join us, Amy. Did you find us from Facebook?
I found FPA a couple of years ago, and I just faded away from. I came once last year to an online meeting, and now it's getting a little more. I'm not a general neuralgia, other face pain, so I see getting more and more about that. So, or both. So anyway, I found that.
Well, I'm glad you found us.
So I found it again, and there's nothing in New York. I know you're all
Really?
everywhere else, but what's that?
Huh.
So where are you? You're in Chicago or?
We're in Michigan, suburban
Michigan.
Detroit.
Okay. There were no groups in New York, nothing local. So I somehow hit this one, and
Good. Well, we're glad you found us. Yeah,
thank you.
we're all over the world now, which is awesome.
Yeah, I think
About that 9:30 note when we're off, Amy.
there's something else tonight with doctors, I think, or
I don't know. Is there something with FPA tonight, Lynn?
I think they were I signed up for something else.
Oh, 9:30 could be California. Would
Yes,
be
it is.
their time. Andy Pettigene might be running it. Okay. We should be through by then.
Okay, I'm happy to. Yeah, I'll just do one and the other, or
Yeah, they've got a great group out there.
I thought, I don't know. I don't know. It was late at night last night when I was finding all of this. So anyway, I'm in I guess the same position as a lot of people. So
Yes, exactly.
here I am.
Who's the lady in the middle, Pete, that joined us on the bottom?
That's Renee. And then we have R. Crecchiola. I don't know who R is. We're trying to do first names since this is recorded.
Yeah.
So we're trying to take away just for privacy's sake.
Hi, Renee. Where are you joining us from?
Lake Orion,
Oh, great.
Michigan.
Fabulous.
You getting
Most
off?
of us are Michiganders here.
Long Island here.
Crecchiola, is that part of the Crecchiola family in Troy?
I'm sorry?
Part of the Crecchiola family in Troy?
No, Cresciola family in New York.
Oh, another New
I don't
Yorker. Okay.
Amy right above you is from New York.
I'm New York. I thought I was the only one.
Glad you found us. Yeah.
You guys have a support group over there? There used to be one in the city.
Not that I know of. I've
visited.
been sorry, I've been searching for years, so nothing I found.
Oh, there's our doctor.
Here she comes to save the day.
You talk about being timely.
Well, at least I'm on. I got signed on. I can't believe it worked. So
Recording in progress.
Got her hydrated.
Hi, guys.
Is that Andrea?
Yes.
Oh, there.
Hi, nice to see you again. Hey, Dana.
Dr.
Hi.
Rossi, Dr.
Wow,
Rossi,
we got a lot of people on today.
Yeah.
Dr. Rossi, do you want to be a co-host?
Say that again?
You want to be a co-host? Are you putting slides up?
Oh, no, nope. I thought we were just doing like a question and answer session.
Q&A.
So,
Just
Yeah,
ask.
Q&A.
super laid back.
Like that. Chill
Thank-
down those nerves, right?
That's right.
Thank you for joining us. How old are those kids now?
13, 11, and 9.
Oh, okay.
Wow.
Okay.
You're a brave soldier.
Yeah.
Don is here too. Dr. Rossi to say hello.
Hi, Dr.
Hello. How are you, Donna?
Good. How are you?
Good.
Yeah, you're ready to hit the teen years with all those. Oh, whoa.
Yep.
That'll be a roller coaster.
Yes, it already is.
Okay, we'll get started. As I put in the note, Dr. Rossi had spoken in the past. One of them was, I think it was November 11th, 15. And so she's got a very detailed presentation there. There may have been another one since then, Doctor. We're behind on putting DVDs on YouTube, but we have, as I stated in the note also, there's 29 videos on YouTube now if you search using my name, Tim Guth. Apologize for that. TNA or FPA helped us put them on the first 10 or 15 and they used my name. So we've continued that, using that to search YouTube. But there's a number by Dr. Casey, who wrote the book Striking Back, and a very good one by Dr. Rossi, as I said, November 11th, I think it was, 2015. Apologize for my, hi, Donna.
Hi.
And we have two more joining. I'll hesitate for a minute. Pete, while you look them up. I know Donna in the middle.
I'm trying to help a woman from the UK get on.
Okay. Is that the lady next to you on the screen?
Is she there? Her name is Sarah.
No, we have Grace that joined us. Hi, Grace.
Hi.
If you could join us.
Oh, that's great. Okay.
Sarah Dodson.
Okay.
Doesn't look like it. The lady to the right bottom is ours from Kalamazoo. Linda. I think that's Linda.
Yep.
It is.
Yes.
Mm-hmm.
She's the one that people have heard me talk about. It had the not the gamma knife, the cyber knife at University of Chicago, which I strongly adamant about that nobody used the cyber knife for trigeminal neuralgia. And if we get time afterwards, she can tell you more about why to avoid it. But we've been saying that, especially we had meetings at Beaumont for the last 25 years. The IRSA recommended to me way back that nobody use the cyber knife for trigeminal because the nerve is so small and the cyber is not as accurate as the gamma knife, which they have in Beaumont and in Midland.
What is that? Is that when they go in there and burn their nerve?
Well, no, they don't open you up or use needles. It's all radiation. The gamma knife. You can Google gamma knife, GAMMA.
Gamma knife I've had.
Yeah, it's all radiation.
Cyber knife is different, though.
And you don't recommend it?
The cyber knife is different, though.
Right.
Yeah, the cyber knife is what I was curious about.
Right.
Don't do it.
Don't do it, Linda says.
Don't do
You're
it.
shaking your head. It's not as accurate as the gamma knife.
Dr. Rossi explain all that too.
That is a neurosurgical thing, not a neurologic thing, but or
delegate
something that a radiation oncologist would do. I've never recommended a cyber knife for any of my patients.
Okay.
Even for non-TN, doctor?
No. I mean, no.
Would you tell me what the cyber knife is?
I'm not even sure. I don't use any of that because I'm not a surgeon.
Aaron, do you want to give her a quick, or we can talk about it later?
I can't remember.
Yeah.
I don't remember the specific differences, but there are differences, right?
Constance, email me that after the meeting, and I'll send you connection on that, or
Okay.
something off the YouTube. Okay.
Okay.
I see a student
on the FPA site too, distinguishing them.
I'm not sure they've got. Well, they might have, yeah, because I think Dr. Brown might have a cyber. So he'd hit me upside of the head if he heard what I'm saying. But we've got evidence that it doesn't work. Donna, is your UK person a student?
No.
I see a student joined us on the lower right.
I don't think so. I just sent her the link again.
Anyway, you can go on YouTube, use my name, and you can find Dr. Rossi's detailed presentation about trigeminal neuralgia. So we agreed that today would be an opportunity to ask questions of Dr. Rossi about trigeminal neuralgia. And if you've got things off subject like cyber, I can cover those with you separately. So who has the first question for Dr. Rossi? Look, there's our student. Anna Duck, you have a question?
Okay, well, how much medicine can you take? How much gabapentin and Tregatol can you take? Can you take as much as 6 a day?
Depends on the dosing. So it goes by dosing. So for gabapentin, the dosing is 1,200 milligrams 3 times a day. So a total of 3,600 milligrams you can take of that in a day. For Tegretol, I don't usually go higher than 600 3 times a day. I've seen patients who are on more than that, but I think the side effects start to get to people and you get hyponatremic and stuff. Mm-hmm. So, and of course too, it's to pain control or to having side effects. And of course, any of these medications, the higher the dosing, the more likely you are to have side effects. So some people can't tolerate that high of a dose, but it is FDA approved to, do those doses that high.
To do 600 3 times a day?
Of the Tegretol.
Yeah.
Mm-hmm.
Can you do that along with the gabapentin?
You can. Yep, you can.
You can.
Mm-hmm.
And the gabapentin just up to 1,200 a day.
No, 3,600 a day. But you have to break it up. You can't take more than 1,200 milligrams at one time. So you'd have to break that up into 3 times a day. So 1,200 3 times a day you can take.
And Dr. Rossi?
You can take 1,200 3 times a day.
Correct.
Mm-hmm. Okay.
Dr. Rossi, I have a question on the gabapentin. I read that at a certain level, it stops losing its effectiveness. Like at a certain, like,
yes.
Yes. Is that true? I mean, let's say I'm on 1,800. If I were to go to, I don't know, 2,500, would it be just a lot less effective?
It stops losing its effectiveness after 1,200 3 times a day. So that's one of the reasons why the dosing stops at that dosing. The bioavailability starts to kind of go down a little bit, but you certainly can have relief in that range, of 1,200 3 times a day versus like 800 or 900.
If you can handle the side effects, right?
You can handle the side effects. If you have side effects, and you can handle them, right? Exactly.
Right.
Yeah, and the Tegretol 600 3 times a day.
Correct.
Okay.
Correct.
And then if that doesn't work, then you just have to go to surgery?
No. There's several other medications. Definitely listen to my lecture because there's several other medications that we do use. There's amitriptyline. Amitriptyline is a tricyclic antidepressant that we actually used to use in the 1970s. But it does work really well for neuralgia-form pain. That can range in dosing from 10 milligrams to 150 milligrams once a day. Usually it's taken at night. The side effect to that is dry mouth. It can cause a little dry mouth and a little fatigue. You can use other anti-epileptic drugs besides Tegretol in gabapentin. So there's pregabalin or Lyrica, which is kind of a sister to gabapentin. I find that the bioavailability is a little bit better with the Lyrica. If Tegretol doesn't work, is a cousin to Tegretol. Oxcarbazepine is the other name for that. So that's an option. Cymbalta can sometimes actually work. Duloxetine, it's an antidepressant. That can work sometimes. You can use Vimpat. Vimpat is an anti-epileptic drug too, or Topamax. There's been studies on baclofen, which is actually an antispasmodic, a muscle relaxer. Lioresal is the other name for that. So baclofen can be used. I'm trying to use the generic names too, just because if there are anybody from the UK, they know they'll have a different brand name.
I remember there's Keppra also.
I
can't remember the generic name for Keppra.
Levetiracetam. Right.
Yeah,
There we go.
It was also one as well for me.
So most antiepileptic drugs can be used to treat pain, neuralgia-form pain as well.
I have another
as
question.
a neurologist, we try to avoid surgery at all costs because it isn't 100%.
Right.
I have another question regarding the gabapentin.
Sure.
Is it true that it can cause memory loss?
It doesn't cause permanent memory loss. Some people say that they feel like they're a little dulled cognitively if they're on higher doses. That can happen. But once you stop the medication, that goes away after like a week or two.
But no permanent memory loss?
No permanent memory loss, correct.
But if you stay on gabapentin, it would be permanent?
If you're on gabapentin and you're having cognitive issues from the dosing you're on, then I would actually just recommend lowering the dose and seeing if that gets better or stopping it. But when you're on it, it will cause it. But if you go off of it, it should go away.
But if you need to be on it, then you don't want to go off it.
Yeah. Or you can talk to your doctor about those other alternatives that I was telling you about too. Yeah, that's the hard thing with this, as you guys know, with this disease process, you kind of walk this little tightrope of pain control versus side effects.
Right.
Where's that line where, you're more comfortable, but you're not having more side effects than are worth dealing with the pain kind of thing. So
Right.
that can be kind of hard.
Right.
I've been on 1,800 milligrams of Neurontin for 25 years. And I think the memory issue is more the aging process than it ever has been the Neurontin. So,
right. and it is a listed side effect. It is a listed side effect to have a little cognitive dulling. So, because what these anti-epileptic drugs do to help control the nerve pain is they're kind of slowing down all of those electric components to the pain nerve firing. So it's not selective to just the pain nerve. It's kind of to all the electricity of the neurons. So that's why some people will have that side effect. It's not everybody gets that side effect, but it can be a potential side effect.
Mm-hmm.
We always say that the anticonvulsants, doctor, are good for the shocks. What about the burning? Does it help the burning as well?
It can help the burning. Yeah.
Okay.
How long should you be taking the medicine before how long does it take to start working? And when should you go? Yeah.
Yeah. So I usually recommend 4 to 6 weeks, closer to the 6 week side. If you notice no difference on that dosing that you're currently on after a month, you probably need a dose adjustment or maybe a switch to something different.
I have a couple questions.
Okay.
And my second question, how does anybody work with this? I mean, you're trying different drugs and, to find what is going to work for you. And that takes 4 to 6 weeks. How do you be fluent with this?
As far as speaking, you mean because of the pain when you're speaking?
Mm-hmm.
That's a hard one. In reality, some people can't, they can't function when they're having such bad pain. Mm-hmm. Everybody's pain kind of varies. So, some people do feel functional, just uncomfortable, whereas other people, they never talk. They barely even talk because anytime they try to talk or brush their teeth or, chew anything, they start to get those things of pain. So that's a hard one to answer because everybody's pain threshold's a little bit different, and what causes their neuralgia to act up is different for everybody too. Some people are fine, but it's when they, eat something sour, or when they're brushing their teeth with mint toothpaste or something. So it really depends on each person individually of who's able to work and who's not, as they're trying to get to that dosing that they need. Once in a while, like probably a handful of times a year, I'll see a patient in the hospital who has to be actually hospitalized and go on IV medications because those kick in a little bit faster.
Yeah.
And they're waiting for the orals to kick in. It's kind of miserable. But that can, in theory, be an option as well.
And my other question would be how I found some information online how this could connect with the COVID shot. And I was diagnosed 1 week ago, and I've been in pain for a straight month, which was 1 week after my second COVID shot. And I found online how the SARS-CoV-2, they found facts that it is directly correlated with the trigeminal nerve. Obviously, it's probably too soon to come out, but it's on a government website. And I mean, I feel that after my second COVID shot, that I got this condition, and it's just immense pain around the clock.
So there's no question any vaccination actually can trigger many different neurologic things, CGN being one of them, TM being one of them. Same thing goes with we've seen cases of any kind of nerve issue can be affected when you take any kind of vaccine. Bell's palsy, trigeminal neuralgia, you can get transverse myelitis, a little inflamed. So that can happen. It's a super low risk actually for the person who gets it. That's 100% for them, but it's it's in like the 0.1, 0.2 range of potentially happening. I have not personally seen a trigeminal exacerbation from a COVID shot yet. I've seen some migraine exacerbations. I've seen quite a few actually transverse myelitis episodes, which are transient and go away after like 6 to 8 weeks. So if it's directly vaccine related, it should go away after 6 to 8 weeks if it's directly related to the vaccine. It would be weird that it would trigger, a permanent case, like some of the people I know that some of the people on this meeting do have for decades.
That's happened to me. I just wanted to say that it's after the vaccine, I can't take the second one because it made it much worse.
But you had it before the vaccine, though, Melody.
Yes,
right?
But I've had to up my Tim, I had to up my gabapentin a lot.
Right. But I'm just saying you had the TN prior to the vaccine. So it exacerbated it. Okay.
Yes.
But I never did. This is totally new.
Yeah. And I'll say too, you kind of have to weigh the risk and benefits of that as well, because you can also get Bell's palsy or ophthalmoplegia or trigeminal neuralgia or transverse myelitis or a stroke from having COVID itself too. So you have to weigh that risk. COVID likes the neurologic system. That's why people lose their taste and smell. That's one of the nerves. That's actually a neuralgia as well. Two of the nerves, I should say. So, for whatever reason, this particular virus, kind of like shingles, it likes to go onto nerves. So there's a risk with the vaccination. I would say probably the risk is higher if you actually contracted COVID. I've seen quite a few things with people who actively had the COVID virus who have been suffering, from that for a couple months too. So it's you're kind of darned if you do and darned if you don't as far as vaccinations versus, risk of exposure to COVID is concerned. I know I have some patients who too struggle a little bit with the mask because of the trigeminal neuralgia too. So that makes it a little harder. Guys are kind of darned if you do and darned if you don't kind of thing.
Mm-hmm.
Did you say that COVID can cause TN, Doc?
COVID can cause any kind of neuralgia. I have not personally seen a trigeminal neuralgia case from COVID specifically, but I've seen several other cranial nerve abnormalities related to COVID infections. Right. So a cranial nerve is a cranial nerve. So it's in theory quite possible for that to happen.
Rachel, are your symptoms shock-like or constant burning, or what are you experiencing?
Well, for the last 4 weeks, it started out almost like a toothache. So I went to the dentist because the cold just shot up my face, and it progressively got worse to where I am now, where it's like difficult to smile or show any facial expression. It's constant around the clock. Like today, I had a couple hours of, it's kind of just sitting there, lingering, letting me know it's there. And if I do the wrong thing, I'm done for the rest of the night.
Do you get shocks then, or is it burning? Or is it, you're describing it as cold, or is it like throbbing? How would you describe it?
When it kicks in, it throbs, it stabs, it burns. And then I have it in both temples and then migraine. So it's like between all that and the right side of my face, like I can't function.
I'm so sorry.
You've been diagnosed with TN, Rach?
A week ago.
By?
A neurologist, and he put me on 300 milligrams twice a day of oxcarbenzapine.
Yeah.
And I had a brain MRI 2 days ago and a fusion because I was in so much pain. So they hooked up the IV for pain and magnesium to relax, and I think 2 other things. So
did that help at all?
Yeah, it definitely helped the temple pain and the migraine. And it did calm this down. But, trying to find like the right medicine to be able to function and be productive at work I'm finding very difficult.
Yeah.
It all depends too what type of work. Could that be a migraine, Lynn or doctor?
It might be 2 different things going on. Normally with a migraine, you're not going to have that constant, incessant, gnawing jaw pain. But for sure, many of my migraineurs, after they had their second COVID shot or after they had COVID, had like a prolonged period of having more headaches.
Yeah.
I'm hoping it might be a short term and not TN.
Yeah.
Yeah.
Maybe, Rach, you could talk to Lynn and I after the meeting. We can go into more depth. Lynn's a nurse, by the way, and I'm a generalist. But we can talk in more depth about what the possibilities are. Don't you think, Lynn?
Absolutely.
Of responding to it.
I'm just curious if have you had migraines for a long time, or is this new?
It's new, on and off, maybe seasonal, but nothing like this. And I've never had temple pain before.
Yeah. Yeah, that's miserable. I had really good luck with Emgality that Dr. Rossi, I'm sure, is very familiar with. That's the anti-CGRP, the calcitonin medication, and it's in clinical trials for TN.
Yes, I had this discussion with a couple other neurologists at a conference actually 2 years ago when all these CGRP receptor antagonists came out, because they inhibit the signal from coming on the trigeminal nucleus, in the brain itself.
Right.
So I have tried a couple times off label using those for trigeminal neuralgia pain. It's just hard to get it covered by insurance because it's not indicated yet.
Right.
There might be something out there, in the next couple of years for
What are they
people.
called? I'm sorry.
Yeah, I'm gonna write
There's 4 of them. Yeah, there's 4 of them. So for the pain that you're talking about, Rachel, everybody just moved. For the pain that you're talking about, Rachel, for the migraine aspect, and maybe might help some of the TN aspect. There's a couple oral CGRP receptor antagonists. One is Nurtec, Nurtec. One is Ubrelvy, Ubrelvy. And then there's 4 injectables as well. There's Emgality, Emgality, Ajovy, Ajovy. These are all injections. And Aimovig, Aimovig. And there's actually an IV one as well called Vyepti, Vyepti. So those are like right on the precipice of being studied specific to trigeminal neuralgia. Those are specific to migraines, so they're expensive. So
there is a drug card. The one that I took in reality, there was a drug card. I didn't pay a penny for it.
Yeah, it just depends on what you're using it for and what you've tried already, too.
Sure.
And of course your neurologist comfort level.
Yeah. The injectable one, it was ENG.
And like Mary, Gality, Emgality. So those are all FDA preferred migraine, but because they work on the trigeminal nucleus, there's some research going on to see if it's going to help the TN patients too.
Okay. Thank you.
Dr. Rossi, I had an interesting finding when in 2019, I ended up getting breast cancer, and I had to have chemo and whatnot. And the chemo made my blood vessels swell, and then it put the pressure on the facial nerves, and I was starting to get shocks on the opposite side. And my oncologist suggested I take Claritin, and that decreased the swelling, and the shocks went away. And we have since been having great luck with patients that get the sinus pressure in the spring and the fall using Claritin or even the neti pot. And sometimes the flares are a lot of times flares are in the spring and the fall with the cold weather changes and the pollen count and everything. And if I had to go through chemo just to learn one trick to share with somebody to get those shocks to go away, it was worth it. It was all worth it. I was amazed. I was so miserable and I was so terrified. I had TN for 25 years, much like Tim. And to find a ray of hope in something that's over the counter, I mean, you still have to check with your doctor, but it makes total sense, doesn't it?
Yeah, it does actually.
Yeah, it was a game changer. We have a dear older lady in our group, and she wasn't able to eat or talk and anything. And she tried the Claritin, and she's like, I can eat, I can talk. It breaks your heart.
Right.
It's so debilitating, but there are seasons that you can get through. I didn't think I'd live a full day with TN when I first got it. I had 3 little kids, and they're all married, and I was able to work as a nurse, go to nursing school, and you will find your balance, Rachel. I know it's scary, and your mind may be going places that it doesn't need to go. Maybe this is just COVID related, and it will break, and you won't have to think about it ever again. I pray that's true for you. Mm-hmm. But if not, you found a village for you, and we're here.
Thank you.
Yeah.
Mm-hmm. You definitely need to talk to Lynn. She's had, as she noted, similar challenges.
I mentioned something about the vaccine.
Yes.
Every time I got the flu shot, I would get a horrible flare of pain that would last several weeks. I did have it before the vaccine, but the vaccine exacerbated my pain horrendously. And what worked to bring my flare down was like a 6-day, sometimes 6 doses of steroids, Medrol dose packs. Mm-hmm. So I wonder.
Those are hard to get though.
Really? Because my doctor would prescribe that when I get in horrible flares. Medrol dose pack.
The prednisone.
Yeah, it's similar to prednisone. Yeah.
Yeah, I've seen, because I also had a neck fusion 6 years ago, they even have a hard time giving me a script for that, for the prednisone. Mm-hmm. They said it has side effects directly to the organs that they don't really like to prescribe it much.
I would think a short course of it.
Yeah. Usually if you're using steroids less than 2 or 3 times a year, that's not going to cause any issues with the adrenal glands.
Yeah.
And we do actually use that sometimes for acute flare-ups too.
Really?
It does help me, just to let you know.
Okay. Yeah.
Great. I've had 2 cervical fusions, and for 10, 15 years, I've gotten injections over at Ford with a specific interventional radiologist that I can share with you later.
Okay.
Yeah.
Dr. Rossi, how often are you able to take steroids along with Tegretol and Neurontin?
I wouldn't do it more often than 2 or 3 times a year.
Only 2 or 3 times a year.
I would, yeah. The problem is if you're on it for a prolonged period of time or too frequently, it can actually cause your adrenal glands to get lazy because it's doing this, putting the cortisol in your system, by mouth rather than using your organs. So make sure adrenal glands get a little lazy.
Mm-hmm.
So my recommendation is not doing it more than 2 or 3 times a year. And
So
usually at that, I wouldn't recommend more than like 9 days in a row.
Okay, so then is it better to increase the Tegretol and the Neurontin, like if you take it AM and PM, to increase it to take it 3 times a day rather than to take the steroid?
If I would recommend that. You want to try to save steroids for emergencies only.
For emergencies.
Yeah.
Okay. Yeah. All right. So then increase it to the afternoon, because I take it AM and PM right now. Yeah. So I'm just wondering, okay, when the warm weather changes, where am I going to go to?
Yeah. You could take it 3 times a day, or depending on your dosing, you could adjust the dosing of the AM and PM as well.
Okay. Thank you.
Marlene, how much do you take of the gabapentin?
The Tegretol, I'm taking 800 total AM, PM, and the Neurontin, I'm taking 400. So 200 AM, 200 PM.
Oh, that's not much.
Yeah,
that's not much.
Pretty darn low dose of gabapentin. Yeah.
So then is it better to just increase the Neurontin, the gabapentin?
I would personally increase the Neurontin.
Yeah.
Tegretol.
Yeah.
Because the higher doses of Tegretol can cause low sodium. So I would do higher doses of the gabapentin.
Yeah.
Neurontin.
So how much could I go to then a day?
If you're doing 200 twice a day, I would probably recommend going up to 300 twice a day. And then you can increase it by like 100 or 200 milligram increments up to 1,200 milligrams with each dose. And you can take up to 3 of those doses.
Okay. So increase it to 300 AM, PM, and then increase by 100.
Right.
Correct. Okay. Correct. Thank you.
Is Dr. Benet prescribing that, Marlene?
Dr. Islander.
Oh, okay.
Yeah, he's really good, Marlene.
Yeah. Okay. Thank you.
I had a question.
Yes.
Sorry, Lynn.
No, go ahead.
I had a question similar to Lynn, and I talked to Lynn about it. Have you seen sinus causes of TN? So on my MRI, I have complete occlusion of my right maxillary sinus, and I have V2 trigeminal neuralgia. Yeah. And I saw a sinus specialist, and she said, I don't know if she recommends clearing out the sinus with surgery, but my TN isn't under control, so my neurologist doesn't recommend it, and she doesn't think it's related. But have you seen that it's related?
I have seen a couple of times where someone's had a tumor in their sinuses, and it's causing edema, and then that's causing a flare up in the TGN. Probably, if you're not having an active flare up, I would probably agree with your neurologist not to go have it cleaned out. But if you have another flare up, I probably would actually. It's not going to hurt anything. Get that out of there, so it's not pushing on that nerve over there.
So it won't cause for more. My TN hasn't been under control yet since I was diagnosed last year. So is it fine? Do you think it won't make it flare even more, the surgery?
I can. As you know, dental work and working anywhere in that area where the nerve is running through can actually flare it up. So if you're not in a flare, I would say don't go there yet.
Okay. Yeah. And then, do you know any treatments for the teeth that trigger TN?
Other than using Ambisol or something like that, I actually wouldn't. I'm sorry. Let me.
Yeah, that's okay.
All right.
Ringing. I would let me restart. I got distracted there. Amisol, baby Amisol can sometimes help.
Okay. That 2% viscous lidocaine, your dentist can prescribe.
I tried that. Yeah, I have that.
No.
Yeah, the tooth is kind of constant. The rest of it's getting better. So, yeah.
Or like, what about viscous lidocaine? That has to be
prescribed.
Yeah,
that's what I've tried. To see. I attended that Cleveland Clinic conference, and they were talking about Botox. Have you seen them use it intraorally?
I've never seen it, in the gums.
Okay.
I've used it, for like drooling and stuff related to Parkinson's, and then of course migraines. But I have not used it for treatment for TN.
Okay. Thank you.
Of course.
Can I just say something about that? I went to an oral surgeon dentist in Cleveland, and he actually did trays that he would put on the teeth that had gabapentin in them and just a variety of different medications, and he would set that tray on your, on that area specifically for that. We moved out of Ohio and came back to Michigan, so I was never able to go through with that, but that was a treatment that he used. I just wanted to throw that out there.
Did it help?
It had gabapentin and a whole pile of things in it, and it was a tray that he would set that, and apparently was helping people.
Did it help you?
I never got to try it because we moved back. Remember, we were in Columbus, Tim?
Yeah. You came to your senses.
I'm on a Zoom.
Move back to Michigan.
Yeah.
It sounds like most people on the call are on gabapentin.
I'll go to another room.
I'm not.
It's probably the safest, don't you think, Doctor?
I find that it interacts less with other medications, like, for example, Tegretol and trileptal or oxcarbazepine. And in some cases, amitriptyline, that can interact with like anticoagulants. So if you're on warfarin, or if you're on Xarelto, or one of those anticoagulants, that can actually interact with anti-epileptic drugs, like drugs we use for TN. But gabapentin you can use. So
gabapentin is
I tend to start with Tegretol just because that's kind of our gold standard.
Right.
But if someone is on a medication that would interact with that, then usually my second go-to is gabapentin.
I've stayed on Neurontin. The gabapentin must have been the filler that was used. I had a sore throat and cough about 15 years ago, 10 years ago.
And some people react differently to different brand names. So not only is there Neurontin, but there's a little higher availability in the gabapentin type products. Right. With like Release. Release is also gabapentin too, but it's a longer half-life, so there's a higher availability, and that's only once a day. And then Horizon, which is also a gabapentin product. And I do find that those tend to work a little quicker too, and you only need to take those once a day as well, both of those medications. And it's gabapentin.
Are they more expensive?
Yes, which is why everybody is on gabapentin instead.
And Neurontin is very expensive. Yeah. So stay with gabapentin if it works. Don't go to Neurontin.
Yeah.
Yeah.
So you see more side. Sorry.
Gabapentin's been really good for me. Thank God for it, really.
Yeah. Sarah, do you have a question you'd like to ask?
A few, please. Hi, I'm in the UK.
Oh, hi, Sarah. Thank you for joining us.
Thank you for inviting me. So basically, I don't think I've got TN. Mine was started 4 years ago. I had toothache one weekend, and then the toothache went, and then on the Monday morning I woke up and my chin was numb, completely numb. Well, felt numb here and tingling. So I went to the dentist. They couldn't find anything wrong, so I was sent to the maxillofacial. They did a corn beam, scans, all sorts, and this went on for like Well, this went on for like 3.5 years. For the first 2 years, I had to just walk around holding my face because my face was just numb here. So eventually they did another cone beam and they said that I had something under a root canal. So they recommended that I had another root canal treatment, which I said no. So I had the tooth out. So I've had the tooth out and my symptoms eventually eased off. But I get flare-ups and I'm not sure why I keep getting flare-ups. When I get flare-ups, it feels like it's numb here, and my lip goes tingly. And then I sometimes feel like my face is all fizzy inside. It's hard to describe, and a bit like a burning on my cheek. And then it also feels like pressure in the teeth underneath where I had the tooth removed. And I find chewing gum helps me when my face is in a flare, when it's numb and tingly. The only thing that stops it for me is chewing gum. So my question is, they think the infection was sitting close to the mental nerve, and that's why I'm getting these sensations. Will I ever, is there anything like I can take, like B12, I've heard there's to repair the nerves. Will it ever go, or will I always be prone to flare-ups? Or are you not, can you not answer that question?
Yeah, it's hard. It's a hard question to answer because everybody's so different. But you know, even if it's the mental nerve, you know, any nerve is a nerve, that you kind of treat them all the same. Probably if it's been going on for more than 3 years, probably might be kind of hanging out with you for good. The hard thing with that is pain is easier to treat than that lack of sensation symptoms. So that numbness and, you know, that lack of feeling doesn't, you know, gabapentins and integratols and you know, those types of medications don't work super well for that.
Why would chewing gum?
Yeah, that's really unusual. I mean, it's the opposite of TN patients, as I'll probably had a shock look on their face when I heard that when chewing gum makes yours better. I don't have a good explanation why chewing.
I was a registered dental assistant. I worked at U of D at the dental school. I wonder if the pressure of you
putting
chewing,
the pressure on the
have you tried like a mouth guard? That has helped people with TN.
No, maybe try that.
I have similar, mine's in my teeth, and I find chewing gum loosens the muscles that are tightening from my teeth.
Dr. Amy, that's brilliant. That makes sense. It loosens the muscle that's so tight.
It doesn't take the pain out, but you get more pain when you get so tight. And chewing sugarless gum helps that part that gets tight around the jaw. So
that's very interesting.
That's why we think the baclofen works, you know, because of the anti-muscle, you know, the muscle relaxing properties.
Right. What does heat feel like, Sarah? You'd have to be really careful not to burn your face, but I know for me, a warm heating pad brings more blood flow to the area, and it does help. And Aaron had this really interesting study he's doing on temperature and pain. And we've all found that our face is colder on the side that hurts. And just putting pressure or heat from my hand, and it's just really interesting what Aaron's looking into. And I was just wondering if heat would help you.
Yeah, when it's in a flare and I've got the numbness and the burning, if I have my hands on my face, and sometimes I have to press here, like put pressure where the infection was.
Right.
Have they tried baclofen for you, Sarah?
I've not tried any medication. I take paracetamol and Nurofen. I take CBD oil and a balm I rub on my face, but
I wonder if baclofen might be an option. I take baclofen.
I'm just wary of I'm a bit not, if I can not take medication, obviously I'll take Nurofen and paracetamol, and they seem to help for things I take them for. I just wonder
Did I send you my history, Sarah?
Pardon?
Did I send you my history of use of opiates for the last 25 years? I can't remember if I sent it to you.
Yeah, I think so.
Yeah, you copied me on it. I saw it. Yeah.
Are they available in the UK?
I'll have to go back through them, and have a look.
Yeah.
I suppose I'm quite lucky in some respects because I have days where I don't have anything, touch wood, and then I have days where I have a flare up for 7 days, but then I can have, today's been all right. So I suppose I should be grateful.
So it's not there all the time?
No, today I've had a good day. Prior to that, I can have days where it's horrendous and burn.
Yeah, I know, but you say a good day, but is there something there all the time? It's just not bad.
No. Some days I'm free from it.
That's a tough thing then to use opiates, and you almost have to have a constant pain rather than coming and going. Yeah.
And I find if I'm stressed as well, I suppose if I keep busy, then it's lessened. And if I'm stressed, then obviously I think I clench when I'm stressed. I think the clenching must put pressure on the mental nerve and set it all off.
Right.
Stress and barometric pressure affect many of us with trigeminal neuralgia.
Yeah.
Me too.
Barometric pressure for sure.
Yeah.
But thank you for inviting me.
Yeah, thank you for coming. The crazy thing about barometric pressure is wherever you decide to locate to, your body will acclimate, and then it will be aggravated by just a tiny increment increase or decrease in the barometric pressure. So we're just recalibrating wherever we go. But Effexor has really helped with my burning pain. I don't know if that would be something that you would consider or ask your doctor about that.
What does your burning pain feel like? Like when people say burning pain, what does it feel?
I was trying to think if I would have thought of the words you used to describe it. In the beginning, I guess it does feel like pins and needles, kind of, and then it just feels
a hot iron.
Yeah.
Or like sunburn.
That's a good description. That's
worse than that.
Yeah.
Yeah, it can feel like sunburn, and then someone slapped the nails down your sunburn a bit.
Yeah. Yeah, there you go. Oh. We could write a song.
What is Effexor?
That's how mine started out. Was
Effexor is venlafaxine. It's an SNRI, a serotonin norepinephrine reuptake inhibitor.
Oh.
So it's kind of in the same family as Cymbalta, duloxetine, which I was talking about earlier. I haven't used Effexor a ton for pain control, but it is something that can be used for pain control as well. But in the UK, they'll probably call it venlafaxine.
Right. I see Dr. Voshi, and I worked at the local hospital, and I asked like, who would you go to if you had to see a neurologist? And they all said, well, we're right at 7 and Mac here. So we weren't out by you, Dr. Rossi, but they all said him. So
Dr. Vochi's great. I love Dr. Vochi.
I love him. He's so good to our patients. Oh, yeah.
He's great.
Yeah, as are you. Thank you for taking care of Kimberly Stump for us, and Therese.
Doctor, can I ask you one more question, please?
Of course.
Yes. Is it possible, I'm wondering if Prolia shots, I take Prolia shots twice a year. Is that possible that it could cause TN?
It shouldn't.
Shouldn't?
TN, no, unless you have like a calcium deposit or something over, that area in your zygoma, but it should not.
Should not. Okay. Thank you.
Of course.
Dr. Rossi?
Yes.
I feel like I'm a hot mess. I'm the one with Cyberknife in Kalamazoo, Michigan. I have 24/7 pain. Not much is helping it. I'm currently on Lyrica 50 milligrams 3 times a day, Baclofen 10 milligrams 3 times a day, and then Trazodone to sleep 25 at night, and that's it. I go to a pain clinic and receive high-dose lidocaine infusions, but the pain is continuing. It's burning. It's numbing. I question if I have anesthesia dolorosa. There has been damage to my optic nerve too, and they just did surgery on my eye because I had palsy and I saw double. So that's been corrected now through U of M, but it has been one thing after another, and I don't know how to manage this. I have tooth pain, burning pain, numbness, and all three areas, forehead, nose, and chin are involved.
Have you tried a higher dose of Lyrica?
No.
That's a really low dose. That's a really low dose of Lyrica. You can use upwards of, you can use 1,200 total milligrams of Lyrica in a full day. So if you're on 50, I mean, you could probably hike that up to 200 3 times a day. I mean, I wouldn't do that all at once because you'll have blurred vision and stuff, but there's room for that. The other thing, I don't know if anybody's had this, and this is a little off-label as well. We use it a lot in cluster headaches, but a sphenopalatine nerve block can sometimes help. Where they it's called. Have you tried that sphenopalatine?
Well, is that where they go into the face?
No. They actually stick a huge catheter, it's like this long.
Oh, okay.
Your nose, and they actually touch the sphenopalatine nerve, and they bathe that in lidocaine actually, and sometimes that will help calm down trigeminal neuralgia too. Again, a little bit off label, and it's hard to find someone who does it.
I don't think do it out of Chicago. They were doing a clinical trial out there for TN with the sphenopalatine.
And I know there's a couple headache specialists in Farmington Hills at the Mind Clinic who do sphenopalatine nerve blocks too. So that's something to consider. But maybe just something as simple as doubling up on your Lyrica dose, or slowly adding another 50 milligrams to each one of your doses over a couple weeks might help with some of that pain that you're having too.
Would an antidepressant, adding that to it, would be that helpful?
And I always try before I add more physicals. I try to dose adjust to titrate dosing first, because sometimes when you're on 3 or 4 different things and they're all low dose, none of them are high enough to help each other. Sometimes trazodone can help too. That's a tricyclic antidepressant as well. So sometimes that can do the job of a Pamela or nortriptyline or amitriptyline.
I know that's low dose, the 25.
Too. Right.
Should I increase? Should they be increasing that?
I would, over all of them, increase the Lyrica, because that one tends to have a quicker result than adjusting the doses of the other stuff.
She actually backed it down.
Really? Why, were you having a side effect?
Well, I just felt mentally dull and sleepy. Sleepy. When I was on
so again, that's the hard part, is you treat the pain, but
sometimes doesn't it take a little while to get adjusted to that though? Because I found that with my gabapentin increases through the years, that at first I'm feeling that feeling of tiredness and dullness, and then after it takes a few weeks to get adjusted to it.
Yeah, usually takes about 4 to 6 weeks to get adjusted to those medications.
Okay, go ahead there, Amy.
So my problem is, I think, atypical, either TN or face pain. It's been called both over the years. And I'm just curious, that's about 10 years already, and I can't get out of pain. I'm always in pain. Does it pay to have a scan? Are there new scans that maybe with dye would show is something being crushed? I pulled teeth. I had to stop because it moved to the next tooth and so on. And I just don't know what to do anymore. Dentists don't want to touch me, and I don't want them to anymore either. But I'm just curious about scanning. Is it to see if there's actually something pressing on a nerve? Is it worth it? And is there
you can see on an MRA, you look through on the MRIs, if you look through Meckel's cave where the blood vessel goes through. But if you don't see anything there, you don't see any enhancement of the nerve over that area, and there's physically nothing there, that's the only scans.
So
There's
that
not a PET scan or something for that. Yeah.
Would it cover like the jaw area where everything is?
It covers where the nerve,
where the back
of, yeah,
the typical brain.
Right. Correct.
But there's nothing to do about a scan for your jaw to see if it was crushed or separated.
Right. Correct. Not specific to the nerve.
Okay.
Was yours a dental problem, Amy?
Yeah, it definitely started dental.
Yeah, we should talk more offline. That's
Okay.
exactly mine.
Yeah.
Yeah.
Okay, you have
Me too, Amy.
Terrible. It doesn't.
About 10 years ago or so, Dr. Casey, who wrote the book Striking Back, said that in the database at that time, about 62% of our members went to a dentist first. That doesn't mean that it was caused by a dentist, but it feels like a dental problem.
It got worse. Yeah.
And I don't know what percentage as of now actually was caused by dental, but it's quite a bit.
I think it's quite a
hundreds online over the years.
And there was nothing in the earlier years. I couldn't even find this, but I definitely know if I pulled the tooth, it moved to the next tooth. So
same here.
Yeah. That's why we spoke to the dental community. Lynn, along with our neurosurgeon from
the laundry room,
talked to the Michigan dental community. It happened to be the same day as my son's wedding, so Lynn covered for us, and I gave a 10-minute video on my history. But yeah, we've tried to get, as an association, we've tried to get to the dental community so that they recognize it, and obviously we haven't done a tremendous job of doing that. But
you have dentists on the facial pain advisory board now, though.
Yeah, but I mean at the state level here,
right. No.
You know, there's always more we can do if God give us more time in the day. But anyway.
Okay, well, I'd love to talk about it again, what you're doing. Thanks.
Yeah.
Okay. Thanks, doctor.
And thanks for keeping your eyes open, Donna, for people in the UK like Lynn does. Lynn watches Facebook all over the place and finds people that are suffering. In the medical books, this might be obvious, but it says that TN is the worst pain known to mankind and called a suicide condition. And we've had 3 of those over our years, and it's 3 too many without emphasizing that. But I say it because if you feel like that, we understand. Lynn and I have both been there. There are answers. It's just that we need to work harder. And luckily we have people like Dr. Rossi there to help us solve some of the problems. But not all are surgically fixed, and not all are medical medicine. In fact, that was the name, as I pointed out, the name of Dr. Rossi's presentation back in 2015. It was medical treatments for TN, and she specifically covered much of what she covered today in terms of medicines. And obviously there's been new ones in the last 6 years since then. But she, I don't want to brag too much while she's on the screen, but we've had 3 or 4 of our patients that I know of, just the ones that I know of, have gone to Dr. Rossi, and they can't stop bragging about how much she's helped. Yeah. Some of them travel from Lansing, Michigan to her office is probably 70 or 80 miles, and they come at least once or twice a year. So, as I said, she's with Beaumont and Ascension here in Rochester Hills. It's a long trek for those of you in New York or the UK, but
I would go anywhere.
Do you do Zoom treatments, Doc?
Do what?
Doctor, do you do online Zoom appointments now?
Not for new patients.
Okay.
There's nothing like laying your hands on a person to make sure that there's nothing else going on.
Right.
So follow-up visits for like med rechecks if people are doing okay, we will, but not for new patients anymore.
So you are seeing patients in the office?
Yep.
Okay. Super.
You work with
back in the office since June of 2019. So June 2020, sorry. They're all
Do
blending
you
together.
work with atypical patients or primary trigeminal neuralgia, really?
Well, I have both. I have both atypical patients and traditional trigeminal neuralgia. Yeah.
Excuse me. Anything else, Lynn? Think we got all the questions out? We can let Dr. Rossi go, and then we'll have our general session.
Renee, do you have anything you'd like to ask?
Not at this point, but just took in a lot of information.
Yeah, it's a lot to wrap your head around. I think that Striking Back book was a godsend to me when I first was diagnosed, because there's just so much information to digest. And now there are several, there's an updated version of it, as well as the Neuropathic Facial Pain by Dr. Brown, Dr. Jeffrey Brown out of New York. He's the president of our Facial Pain Association. And we will get with our chair of the facial pain group and see if we can get some support groups going in New York. That's frustrating that we don't have enough. Are you closer? Are you north?
I'm on Long Island.
Okay.
I mean, I can get into the city or.
There was one in New York City because Claire way back invited me to it, and I attended it. It was right in the city, and I don't know if that's going yet.
I mean, I searched, but maybe I'm hitting the wrong features. How long ago was it?
Oh, Lord.
I mean, I'm doing this for 10 years, but there was nothing 10 years ago. And
it's more than 10 years ago.
How far is New Jersey from you, Amy?
Different parts. It's an hour is the closest to the border, and then there's different.
Okay, we have a really good support group leader there, Ann Sarnecki.
Yeah.
Where was that, Lynn?
Ann Sarnecki is in New Jersey.
Oh, Jersey.
Yeah.
Wait, let's give Dr. Rossi a hand. We can let her get back to her children.
Thank you so much, Dr. Rossi.
Everybody, I hope you feel better.
Yeah.
Thank you.
Thank you. And that's even fun, Dr. Rossi. We appreciate you.
Of course. Thank you. Bye, guys.
Bye-bye.
Thank you.
In Jersey, there's one. Did you check the facial pain website, Amy?
Should I what? I'm sorry.
You checked the facial pain website?
I saw something today when I was checking it in New Jersey. Like 2 years ago, I was going to go to there was a big thing in San Diego, and
right, we were going to go there too. We were all going to meet there.
I had the tickets and the plane was booked. There were fires very close in California, so we decided not to go. And I thought it would be my chance to find a doctor that would be like, help me.
Right.
So I didn't know where to look after that. Really, Facebook sort of gives me a little bit like, you're putting yourself on there, and then you don't know who you're talking to.
Are you on the official Facebook Trigeminal Neuralgia Association book?
Right.
I mean, Facebook page?
Okay. Yeah, I just found that yesterday, really.
Okay. That's the only one I go on. Because you're right. You don't know where they're getting their information or if they're truly.
And they see you in your regular Facebook, I feel like once they have your name, it's like, I don't know. It was just strange. But I would look for this one, and I saw it last night. But I also feel everything is very typical trigeminal neuralgia and not a lot of tooth damage.
Yeah. And the best advice I ever got was from a neurosurgeon at one of the conferences in San Diego. And he said, Tim, if the morphine is working for you, do not have any surgical procedures, because it's possible that it'll make it worse. And I followed his advice because the morphine has worked for me. It may not work for everybody. And in today's climate, it's damn tough to get it. In fact, my pain specialist, I found out that Melody was the last one I got in about a year ago, Mel. And I just found out why. He was just diagnosed at University of Michigan with ALS. So now I know why he wasn't taking any more of the people I was recommending. One of the doctors that I had oral surgeon left the state 5 or 6 years ago, I had 30 of our members with him. All had atypical, and I think most of them were taking some level of morphine. I've been at 400 milligrams a day, as high as 600 milligrams a day. And there are days that I still suffer when the weather changes significantly or the barometric pressure. I'll still go almost closed off in the bedroom with ice packs. So this condition is not something I wish on my worst enemy.
No, in fact that the pain medicines do help and they don't want
the anticonvulsant.
It's almost cruel, like it is cruel. But
well, Amy, do pain medications help you?
They did, but it's just my doctor that I was sent to passed away, and after that, the new doctors didn't want to do it. They weren't. Nobody really knew about what I have, so it was just a pain management doctor who really,
right.
So I was
what were
given
you
relaxers and
what were you taking, Amy?
I had the immediate release of codeine, and it would help for a little while. And then I take Klonopin, which takes away the tingle part, but not the bone pain. Like it's just bone pain. And if that Klonopin wears off, I start tingling all the way from the lip down. So I'll give that to them.
You weren't on the stronger narcotic then?
No, they wouldn't. They just wouldn't. They didn't know what to do with me. And yet, I mean, I was lucky I got to them for that little bit of time because it did help. And then he passed away, and he knew. He was a very smart man and a good doctor. And my physician sent me to him because they didn't want me pulling any more teeth. It was like, stop pulling the teeth, and because it wasn't helping, and it was making it worse.
Did I send you my history?
No, I don't think so. I'll have to.
If you don't have it, let me know. What the use for the history is, you can't really go into a pain specialist and your doctor and say, hey, I want morphine, because then they think you're a drug seeker. Mm-hmm. But by using my one pager, you can say, here's this dummy out in Michigan that this works for him. What do you think, doctor? It's better than you going in and asking for a strong medication. And you don't know, maybe it won't work for you.
Right.
It'll constipate the hell out of you, and we got answers for that too.
Right.
But,
no, I know. And I just think that I can't believe the chain isn't spreading out more. There seems to be a need for it. And yet
the CDC, am I saying that right, Lynn, came out with guidelines of a max of 90 milligrams of morphine a day as guidelines I don't know how many years ago, 4 or 5 years ago. And that many doctors stopped. In fact, Dr. Rossi's group for a while stopped giving it opiates. And now their latest to me was they'll give it to their grandfather. They grandfather some of their patients, but there's such fear of the DEA and more the state licensing bureau has been harassing my doctor that was just diagnosed with ALS. So they're probably laying off him now that he's got that condition. But he was one of the top 10 prescribers in Michigan because that's all he did was give either injections of steroids, put in stims, or he wasn't I need a Z-Pack or something. He didn't do that. No. So it wasn't surprising that he's in the top 10.
Well, that's what pain management's supposed to be doing.
Right. But they've got the fear in them. Now, what's moving is on this one site I can send you if you remind me. I forget what the name of it is, Aaron or Lynn, but it's Pain Associates or something, Aaron.
Well, the CDC, those guidelines were recommended only. The intent was for general pain or general practitioners, not for pain management.
Right.
But the feds were going after pain management doctors.
The insurance companies grabbed a hold of it and used it to avoid costs. Let's be honest. Anyway, there is a movement to redo those and re-emphasize the fact that they're guidelines and not to be used as law. So they would allow doctors to go above that. I know a couple other doctors that I've used over the years. One is Lynn's neurologist, Dr. Voci, who's an excellent doctor. And there's a Dr. Tech. It's an Indian name. It's a long name that I've gone to in the past here in Southfield. And I'm going to have to start tapping some of these other doctors to look for who else we can find that's willing to take on new TN2, ATN, neuropathic facial pain. We don't care what the hell you call it. It's just that the anticonvulsants will take care of the shocks, but not the constant pain.
I don't get the shocks. I'm constant pain. And I tried all those medicines. This is maybe it's 12 years already. I started on everything.
Well, you didn't have everything. You didn't have everything from what you said.
Neurontin, gabapentin. I mean, I was this is 10, 12 years already.
You didn't have morphine, though.
No. Because once it got, I think that, once my doctor passed away, I think he would have worked with me, but that was it.
Right.
He was there.
You really have to build a relationship. You really do. It's so going around and investing in someone that's maybe a little younger than you. They're
younger than me now, the new ones, and they don't
know, but that's a good thing.
They don't know. He's terrified. He's like, he really is. He's scared. He doesn't want to. He wants to give shots to everybody. Right. There's nothing to give me a shot for. So
right.
Remind me to send you the history, and you can at least try to use that with your pain specialist.
You can reach out to the medical advisory board with Dr. Brown. Tim and I had a great conference with him and support group leaders, and we talked about our most difficult cases that our patients were struggling with, and he made the time to. He said he will see anybody on telehealth, that he will consult with any of our patients, you guys.
Where is he located?
He is in New York. He is on Long Island.
But let's face it, Lynn, most of those are surgeons, and I haven't heard from one of them.
But that doesn't mean he wouldn't still.
Who is that again?
Dr. Jeffrey Brown, the guy who put in your MCM.
Oh, yeah.
He put his motor cortex in. Aaron, you can explain that.
Is that you put something in like
Yeah, I have it's called a motor cortex stimulator, and it literally it's electrodes that are on my brain that send signals back into where my face is on my somatotopic map,
right,
and keeps the constant pain away. And it works very well for the constant pain. It doesn't work real well for breakthrough constant pain. It doesn't work as well, but for the constant, all the time pain, it works very well for me. And I've had to be recently, it's been 10 years now. I've had to get back onto low dose of opiates. I think what am I on? 100, I don't know how many, I don't know what I'm on now, but it's more than 90.
And it's
because my previous pain management doctor wouldn't go above 90 because of the CDC guidelines.
So I got him to my pain doctor, and he's giving you more now, right? Yeah.
Yeah, he's given me more, and that's helped me tremendously.
So back to the issue. I don't disagree with Lynn. We have interesting conversations. Let me just say that at the conference she was talking about, I submitted a question about the use of opiates, and the coordinator of the conference skipped over my question and would not raise it to the surgeons. So even a surgeon here I love, who's done my last cervical fusion, they don't want any part of it. My internist that I've had for 25 or 30 years, they don't want to touch it. And I understand why, because they're not educated in the use of it. Titrating and prescribing opiates is not an everyday sort of thing. These people have to go tremendous years of training before they're qualified to do it. That's why internists, general pracs, neurologists, most of them, except Lynn's got a great one, Dr. Voci. I don't know how he is with new patients. I've seen him once or twice, and he's superb. And Lynn, he gives you some, right?
Yes.
Right. But they're few and far between out there.
Yeah, my neurologist would not. He did it for like a couple of times, but he said he couldn't do it anymore. It was a black mark on his practice.
And I got Melody to go to my internist, and she got Norco 1 month. We leaned on him, and he gave her enough until I could get her into Dr. Pepler, and now he's got ALS. So I've got to work on finding another local doctor here in Michigan,
right,
that will be willing to take us on.
Right.
Yeah.
Let me know, because I'll travel. This is terrible because, it's exhausting. I'm getting older. It's my 50s went to my 60s, and what happens? How do I get to my 70s? It's like, I don't know.
Yeah, you need help.
But you start to think about every day. It's like,
yeah, I think
get
it's
this far, am I going to go
out of our heads?
But I think, as Lynn said, it would be worth a trip to Dr. Jeffrey Brown and see. But
you don't even have to go there. You can have it on. He is willing to consult.
Right.
Right?
But he's also going to talk to you about the cyberknife, because they got a cyberknife right where he works. And we're recommending against that. But
I don't have TN to begin with. TN
right.
Classic.
If they got a machine, they'll try to sell you on it. I'm talking in general, not with Dr. Brown. But if they got a machine, they've got to amortize. That's the best thing God ever sent,
Yep.
Yeah.
Being honest, guys.
They just keep making them better and better. Yep.
This is not something to screw around with.
No.
And you can leave this on the video, Pete. I'm not going to sugarcoat it.
There's been times I've wanted to find somebody to operate on me, and then I know it could be terrible. That's your brain. And I'm like,
there's no operation that we know of that will fix atypical trigeminal.
No.
Right.
No,
no destructive procedure will fix atypical TN.
No.
None.
What about the rhizotomies, Aaron?
No, those are all destructive procedures, and they will not help TN at all, or they will not help ATN at all. Right. Those are for typical TN, and they can make ATN worse.
I think what we have is nerve damage that is not like a typical TN. It's just plain nerve damage, and you just have to find, is it an opioid or what is it that will take that pain away?
The reason
help with that nerve pain.
Aaron, is that the objective of the rhizotomy is to put a lesion on the nerve and stop the signal from going to the brain. That's why, Lynn or Aaron, I defer to you. I can't remember, Lynn. I should know the answer to that after this many years. What I had heard.
Yeah, that's right. It damages the nerve, so it doesn't send the signal back into the brain, or it changes it. It blocks it.
It blocks it. The scar tissue blocks the nerve signal, is what.
What I've heard in the past is they'll say it's a 50-50. I think Linsky said that when we had him speak.
I don't remember.
And we also have to remember that when we have facial pain like this, and our pain, say, is an 8, success to Dr. Linsky and many of the neurosurgeons or neurologists even is getting your pain to a 5, like livable. A 5 is still really miserable.
Yeah.
Really
miserable to be able to try to live your life. And you really have to advocate for yourself and ask to try different things. I found that Robaxin, they gave me when I broke my back, and that has really helped because it stops the spasms that cause the facial pain.
What was it called?
The nerve pain to my back. And
Robaxin. ROB
AXIN.
Is that
AX? Yeah. I mean, it's kind of in the baclofen family, but it doesn't make you dopey. Like it doesn't, I have no problem taking it with gabapentin and Effexor. And
what is it? What is it, Lynn? Robaxin?
Robaxin. I'll put it in the chat.
Okay. Does it make your stomach hurt, Robaxin? Like baclofen's supposed to not be great for your stomach, or maybe I'm thinking of something else.
No, Robaxin is not a problem for your stomach.
No, baclofen.
Thanks, Pete.
Pete put it on the screen.
Oh, did he? Okay. Yeah. He's fast.
Baclofen does not bother my stomach.
It doesn't. Okay.
It doesn't. Mine either.
When I took it, when they misdiagnosed me in the very beginning, and it wasn't Dr. Boshi. They thought, since I was like 34, turning 35, they thought anybody that got this kind of facial pain that young, that it was related to MS. So they treated me for 7 years with daily injections of Copaxone, and the baclofen makes your muscles kind of like
loose.
Yeah, loose and kind of wobbly. I just didn't like that feeling. I liked the nerve pain and the spasms. I don't know if it works in a different way, but Robaxin is what works for me, along with Effexor. And you know, I did not want to start on OxyContin, but I had no choice. It was just constant burning, and I could not. I had 3 kids to raise. We had life to live, and I couldn't have gotten through it. I only take 15 twice a day, but it's enough to dull the burning pain. And between the Effexor and the gabapentin, and it's what gets me through. I've had like a solid 5 years that were great on Lamictal, and then I had 4 or 5 years that Keppra worked really well for me, and then your body kind of adjusts to it, and it may not be as effective, but there are a lot of medicines out there now, and there are so many support groups. You could go to a support group meeting every night. We have them all over the world now. When we started, we didn't have any. It was Claire in New Jersey.
I remember this when I looked.
Yeah, there was nothing.
No, other than nothing. There was nothing. There was
nothing. And you couldn't do
everything was in your head, and you were physical and everything, you know, nerve.
But wouldn't you say the problem is finding the doctor that will help us with this?
That's exactly right. But it started out years ago that it's mostly women in their 50s and they're hysterical. It's just, that was back in, I guess, 10, 12 years ago. And now I found the FDA, but it took a long time. It was years of just not even
almost 30 years.
Anybody else out there. And my dentists all acted like, you know, there's nothing. And it's going to happen.
Oh, yeah. Dentists have been I've been to so many dentists, and a lot of them say they've never even seen it.
Nope.
So it's so frustrating.
Right? With all these dental implants that they're selling on TV, people are going to get hurt a lot. I feel like warning people, like, be careful. And it's going to.
I avoided that. I had the remaining upper teeth all removed rather than putting in 4 implants.
I don't blame you. You had sinus issues? Oh, I don't blame you at all.
The infection. My infected root canal ate through the sinus bone. Anyway, back to Robaxin just quickly. Lynn has had great luck with it. I won't get into detail, but I took morphine and Robaxin too close together, and I had an incident. So, and my pharmacist warned me about it. Just watch what you're taking with Robaxin. Lynn swears by it, so I agree with her.
You're at a very high level, though, Tim. That's not.
That was 500. It wasn't a 750.
No. I'm saying the
morphine
of morphine. That's
No, that's what I say.
Yeah.
If you're, and most people aren't on that high, so.
Right.
With the morphine, also in terms of breakthrough, like Aaron talked about, I have it used to be called MS Contin. It went generic in 2017 to morphine sulfate. And then there's another med called MSIR, which is morphine sulfate immediate release, which will hit your system in 5 minutes. That's for breakthrough that Aaron was talking about. So you need to be taking the morphine sulfate as a base.
And
I take 100 milligrams every 6 hours. And then if I get nailed with a storm coming, I can tell 24 hours in advance that it's going to hit. I can take an MSIR. Those are either 15 or 30 milligram. And that, bam, it hits your system. Not as quick as an IV in the emergency room.
No,
but,
no, it still takes 20 minutes sometimes to.
Do you have MSIR here?
Yeah, it still takes me a while to get it. I mean, it takes a while to kick in.
And that's with the electric stimulus.
And that's still with the electric. The stimulator is good for the base level constant pain, but I can't. But I've tried turning it up when I have breakthrough pain, and I haven't found a way to get it to control it.
And you have pain in your teeth, in your mouth, in the jaw.
I used to, yes, but most of the time now I have pain in my cheek and jaw, and a little bit around my eye.
And mine's starting to travel up to my ear, so I'm concerned like it's traveling.
I get the best recommendation for you. I have it in my I have stabbing ear pain from it too. I have it in all 3 divisions. But my daughter-in-law is a doctor of pharmacy, and she said, Mom, that Toradol works so well for you. They have a let's see if I have it on me. Yes. They have a liquid form, and it's called Ketorolac. This is an ophthalmic solution, but you can. It's called Ketorolac tromethamine.
On your nose, Lynn?
No. It looks like that, but it's a dropper. So you put it in your ears. It's just like Toradol, so it's an NSAID. It's an anti-inflammatory, and it's a analgesic, so it helps with pain and calming things down. And just like 3 drops in each ear, it just stops the stabbing pain. And you can even use it in your eyes. You can't use like anything in your ears, in your eyes, obviously, but it's sterile enough that if you can
medicine,
you can put it in your ears.
Does everybody pretty much have it on one side? It's all.
Mine is all right-sided.
Yeah.
Mine's right-sided.
I'm left-sided, but it's just stayed on one side. But
yeah,
that's what I've heard happens. Red happens, which is also another strange fact about it. But I guess I'm lucky right now that's all it's.
Has anyone tried the CBD oil? Do you not?
I tried it, and it's kind of strange here. I don't know how it is over where you're at, but I tried some stuff that they gave me, but then they stopped because they're going through changes with what the manufacturers or whatever. So I did try like some extract that I took a little bit, and it did sort of help a little bit, but then they stopped making it, and I don't want to. I tried one other thing that it would just made me. It had too much of the THC in it, and I got very, very paranoid, and I didn't like the feeling, and I don't know. I don't know how. It's like what? How do you take it?
Right.
In the
I've got 3 different models of it. I have never tried it.
I use the CBD oil like salad dressing, like to have a medium to take it, but it just makes me tired and hungry. It doesn't really help at all for the pain.
Somebody said it helps you sleep.
In the UK, we have it's Entranarge oil, so it's they sell it here, but obviously it's not got the THC in it. I don't think it. I think it works a little bit, but I'm not sure. Does anybody take vitamins like turmeric or anything like that?
I tried turmeric.
Does that not
turmeric
work?
with pepper in it, because
Does
it
that
makes
work?
it strong. But it's very anti-inflammatory, you know.
Yeah.
Yeah, I didn't see a whole lot of difference with it. I tried it for a while.
The tray, whoever was talking about the medicine, the gabapentin in the tray.
Me.
So I was at a specialist. He's a TMJ specialist, but he was willing, since he didn't have anything to do with my problem, to acknowledge this exists and there's nothing I could really do about it a couple of years ago. And every now and then I'd fall back to him, we tried a night guard, whatever. But he did say that putting things on the gum helps. But my question to him was, does it burn the tissue? And he said yes. So I was afraid of it getting deeper into the root or other roots. So it's something I want to give you something else to think about, but I was worried about it going deeper into my gums. So
yeah, and having worse nerve pain.
Right.
Yeah, you don't need that. Yeah, people in the olden days used to tell them to put an aspirin by your tooth. Remember? And it would
eat away your tooth.
Yeah.
You don't want them all eaten away now. But I feel like if there's a nerve that's crushed, which is why I asked her that, why can't it be, I don't know, severed, something? I don't know. Like, this is where I can't find.
Nerves regrow is the problem. Nerves do regrow. And that's why they're separating with the Teflon pad. But they still don't know that that's truly the answer. Because you still have MVD patients that the pain comes back. So we're still learning.
We should point out that Lynn and I were lucky enough I think it was 1996, a young lady named Pam Biske, Biske, started the group down at Detroit Rehab. And that's where Lynn and I first met. And God bless her, she had 2 MVDs by Dr. Janetta, developed the MVD.
Yep, I read about her.
Earned his residency, I think, out in Southern Cal. And she started the group, and after a year or so, or 6 months, we broke off because Claire had said many of the larger cities have two support groups. So, Nell Scribner, who passed away here recently, ran the Detroit group for a number of years afterward. And anyway, our daughter collects our notes that we send out. I don't think she's ever joined us. I'm trying to get Pam to come on, but she's quite shy. But she was superb in starting our group. So Lynn and I have her to be thankful for.
It is nice. I'm just lost it.
Pam ever watches these videos. I'm never to thank her.
Yeah, it is very isolating to have something that people can't see, they can't recognize, and yet you're in agony all the time. And it's hard on our families. It's hard on that big guy up in the corner.
Yeah.
My kids were in college when I got it, and I want to deal with them as adults, and I hide more than I join because
it's so
tiring. It's exhausting, and
right.
They want to come over and stay over, and it's like, oh wow, I have to be on. And
right.
Yeah.
I think it's really important that we try to, our nervous system is already fired up, and we need to use that. Not that meditation or any of that's going to really help take away the nerve pain, but it will help calm your nervous system. And I took a mind-body stress reduction class through the Gilda's Club here when I had the breast cancer, and even just smelling a lavender candle, a jasmine candle, and going from your head to your toe, tightening things and loosening them, and you do control a lot of everything.
Right.
So we
had to start with that when I first started pain management, and he was giving me the immediate release coding. He had me going into a person in there that taught meditation, and I went through it. I believe in it. I also did acupuncture last year. I've tried everything that they want me to, pain management, but they won't give me pain medicine. So, including from all the neurology medicine from the neurologists. But you could do that all day, but then you can't have a day. And
right, exactly. I know here in Michigan, Dr. Rossi told Tim and I that he has oncologists coming to him asking him to prescribe opioids for his patients because they're afraid to. It's
wow.
It's messed up.
Wow.
Rachel, I don't know if we addressed your issue that you brought up. How do you work with this condition? And I'm just thinking about that. I had to go on long-term disability as an executive of General Motors. It probably depends on what you're doing. If you're driving a forklift or a over the highway, I wouldn't. I don't think that's your career, but those are kind of things I would avoid being on these strong anticonvulsants. You want to share a little more of what you have to deal with as far as work? It's up to you. I don't. And maybe we can add something.
Well, basically for my work, I do sales for a Fortune 500 company, and a lot of my work is from home, but 25% of it is out and about, being in the field. So I just don't know, like at the times when I can't open my mouth or I can't talk, I'm like, what am I going to do? How am I going to function? June 25th, I'm supposed to give an hour-and-a-half presentation to 300 people. And between the medicine making me feel lightheaded and funky, and heaven forbid all this pain come up at that time, like I don't know what I'm going to do. And am I going to get fired because of a bad performance? Or do I go on a disability? Like I have no idea how any of this works or what.
I missed your first statement. You do what? Was it sales?
Yes.
Sales. Okay. Yeah. That's
we had a model.
Yeah, I have a problem just concentrating, and my writing ability has gone way down. I can't concentrate.
I think based on Aaron's experience, excuse me, Aaron, you really need to. When somebody comes down with a condition, in fact, my son recently had some issues. Do you stop telling management about it? I think and Lynn could add to this, I think with this condition, especially if you're going to have to do a presentation, you need to in some way share with them or your supervisor exactly what's going on and why you can't do this before something happens like a bad performance rating or something.
Maybe there's some way that they could help support you, Rachel, and have someone else help you present. So if you started talking and the stabs came or you couldn't function, that someone could help, bridge that gap. Because
I need to send you the booklet from FDA. It's called Neuropathic Pain, and that be something in written material. It's excellent that you can share if you decide to. Everybody's case is different. You can send me your address. I have copies, and they're available online. I don't think FDA has got any more to send out. You have to print it. I've got hard copy. I can mail to you, Rachel. And then you decide whether that's a document you want to share with them to show them exactly. Have you been diagnosed?
Last week she was, yeah.
Yeah, I forgot.
Dr. Rossi counseled me and said, you've put your body through enough. And I lost a lot of weight, and just trying to live on that kind of medicine. And he thought it was better to go on disability. I've been on disability since 2003.
Yeah, and I lasted 3 years on medications alone before I finally was pushed to decide to have the motor cortex implant. And unfortunately, I lasted a long time on medication and motor cortex, but then on top of it, a couple of years ago, I came down with TN, just the shocks on top of it. And when I got let go from GM, when they downsized, when they got rid of everybody at Powertrain and they downsized the vehicle engineering as well, I lost my job. And when I was trying to look, I thought I could find a job, but when I was concentrating and trying to communicate with people, I couldn't do it. I not only is my brain, am I slower, but I couldn't sustain the focus and I couldn't sustain the concentration that I needed to even find a stinking job. It's crazy because I never used to be like this.
Aaron, do you think the implant had anything to do with that, or the medication?
Mm-hmm.
Well, nobody knows what caused it, because coincidentally, maybe it was a coincidence, but I was trying high dose. Well, no, I did high dose laser therapy a month after I started coming down with the shocks, but it progressively got worse. But I don't think the implant caused it, and I don't think the high dose laser therapy caused it. And
what's high dose laser therapy?
It's from Jeff Morton's pain-free life centers.
Oh,
I tried
yeah.
that.
I tried them. I
never got our video on YouTube yet. That's one of the 6 I'm behind on. That was a couple of years ago. If anybody wants a copy of that, I can duplicate it and mail you a copy. We never got it to YouTube yet.
Aaron, I went in to see them, and I asked the question, could it make my TN, atypical TN worse? And he said, yes, it could. So I said, forget it then. I'm not paying the money, and it could get worse.
He said the same thing to me, but he told me it was temporary. And that definitely happened. It definitely got worse temporarily, but then it got better. I was actually able to reduce my opiates considerably, but then I couldn't sustain the visits, and because of my shocks, I couldn't sit still because of the shocks. I still jump, but thank God they're not fiery anymore or electric. But I still jump when I'm listening. I was doing that earlier in this session.
Wow.
Yeah, I'm still doing it. I still jump, and I haven't found a med yet to completely control the shocks. I don't think there is one out there.
And Rachel, when I was recommending what you possibly do, I had Aaron's in the back of my mind. I had Aaron's history. And I feel bad myself at having been a GM executive for 30 years, and Aaron being in our support group. I look back at it and wish I would have done more. I never told Aaron this, but I wish I would have done more to push him to request long-term disability. At 52, my pain specialist and psychologist recommended that I go on long-term disability. Number one, I had good benefits. And number two, they felt that in a management position, the stress and the pain would come to such a level that I wouldn't be able to function. And knowing that, again, I apologize to Aaron for
Tim, that's no.
Talk to some people. Knowing a lot of the people that run the place, I should have pushed Aaron more in the early days, knowing what the recommended to me. We may have had those discussions, but I just didn't push hard enough.
I think the tough part was that Aaron was a young dad, had a couple
I was 33.
Yeah.
I was 31 when I came down with this, and 33 when I finally, couldn't function anymore and wanted to do the surgery.
Hindsight's always clear, Aaron, I know.
So he tried
I guess hindsight.
Yeah.
But I did get a few.
Yeah, sorry.
Well, I did get some quality years after the motor cortex implant, but I ended up back on pain medications anyway. and pain medications and anticonvulsants. Anyway, but it bought me time.
It did buy you time. You got to raise.
And it bought me some time.
Yeah, and you were able to work for like 10 more years or something, right? That's a
since
a young man's life.
What?
And it still works.
15 years? I can't do the math. And the motor cortex still works.
From the peanut gallery listening over.
Got a super partner.
This is
Danielle's in the background there. She's
Danielle.
Another angel.
No.
Yeah.
He had an episode last week where his battery died. He didn't realize it. And he was in a lot of pain. And so his motor cortex wasn't on, and he finally realized it after a while, and he turned it back on, and it helped a lot still.
Wow.
So even after all these years, it still does.
You can tell the difference. Yeah.
Yeah.
It still works. Thank God. You know, I don't know what I'd do without it. I mean, I need to be on a hell of a lot more opiates. That's for darn sure.
And then the trouble is your organs can only take that for so long.
Right.
My organs are still working.
I don't know how you're still
and I want to
working.
I want to get to be like Tim.
Tim's are still working.
And I want time, and I need a place to go in my level of opiates, because I didn't want to be at 500 milligrams of opiates at age 40.
Right, exactly. You still make a move, Aaron.
Being 60 versus 40, you know,
different.
That's 20 years of life. You know, there's a lot of shit that happens.
There's a lot of good stuff that happens. Yeah.
There's a lot of good stuff happens, and there's stress too. But it's so I was trying to buy time with that motor cortex stimulator.
Yeah,
and it sounds like it did.
What caused Aaron's TN? What did they ever find out what caused it?
No, nobody knows what caused the atypical TN or the typical TN. Dr. Brown speculated that the ATN might have started from the herpes zoster virus, you know, the chickenpox virus, because everybody has it and it just stays dormant.
What?
But I never had shingles either.
I never heard of that.
I never had shingles, nothing like that.
Didn't have a dental procedure, Aaron, that might have caused it?
I had the dental procedure 2 weeks before.
Oh, wow.
I came down with the ATN, and then before that, I remembered that I had this whole weird left side of my body sensation that it was going numb, and I didn't think it was any. It was 2 months. It was 2 months before. The whole left side of my body was numb, like down my arm, rather. My left side of my arm, I thought I was having a heart attack.
Right.
And I didn't think they were related. Nobody was able to connect the dots. And
were you on meds then? Were you on medication then?
No, I was on nothing. That was before everything.
Oh.
That was before everything. So those were the two things that happened. Was the possible heart attack, which it wasn't anything to do with that, and then the dental procedure, or the dental cleaning rather. It was just a cleaning where they just scrape the plaque off. I don't think so. Well, you get a little bit, but then 2 weeks later I started with this burning in my chin, and it slowly, and it was in the morning. It started with a burning, and then slowly that day it just worked its way up, burning and burning and burning, until I felt like I had a sunburn on the whole left side of my face. And then it took a few weeks, at least a month, before the burning started to fade away, and then it turned into numbness and pain. And that's when I got lucky and found a doctor that diagnosed me before I went back to the dentist and started having all of my teeth removed. Because
you didn't have any, you had an MRI and you had no artery or veins on the nerve?
Not from what anybody could tell.
You had an MRI?
I had another. I can't have an MRI with the implant, of course, but I had another CT scan or a CTA back at Cleveland Clinic a couple of years ago, and that came out negative too. But, you know, it kind of depends on the radiologist and whoever's reading it and all that stuff. So it was Harold Goforth at Cleveland.
So you don't have compressions then when they did the...
No.
No, his started out as atypical, but then you did get shocks.
Wow.
Yeah, just 3 years ago, it started off as I started getting shocks, and I don't have the classical triggers. I can touch my face and brush my teeth. I don't have any of the classical triggers, which it stumped Harold Goforth too. He didn't. It was at Cleveland Clinic.
The question is, did you have any shocks when it first started? Because usually typical trigeminal will turn into atypical over a period of time.
I never had any shocks. Never. I'm a strange one. I don't know why, but I'm a strange case.
Does cold air bother you, Aaron? I thought cold air and pressure changes bothered you, right?
Pressure changes bothered me, but cold air doesn't bother me.
Cold air only affected classic, Lynn. I haven't found anybody with ATN
me.
Yeah, but you had classic too. That's why you had the MVD, right?
Well, yeah, mine overlapped between.
Right.
But it was predominantly burning.
Did that help it, the MVD?
It helped like the stabbing eye pain, but it didn't help the constant burning.
What about eating? Does eating bother anybody?
Yes.
I can eat, but I can't. But I get constant pain after I digest my food. It's really weird. Like 20 minutes after I drank a beer, you know, years and years and years ago, I would have a beer, and then 20 minutes later, I was in agony with constant pain in my face.
Wow.
That was weird.
Reaction. Yeah.
I've changed my diet a lot, and I don't eat as much.
Yeah.
I've lost a lot of weight because of it, but
yeah,
I'm gluten free. I don't eat corn, no dairy.
Because of this,
you
you
know,
wanted it to help. You thought it might help.
Yeah, I thought it might help to cut out all these things that might be inflammatory to my body.
Right.
Do you notice a difference?
The gluten-free helped a lot because the wheat is bad news for me. No bread is I can't have any bread.
Wow.
We found out years ago, Lynn, aspartame. Is it aspartame? What was it in Coke?
Oh, aspartame.
Yeah, aspartame affected a number of people.
That's right. I remember we had a support group member that had aspartame.
We moved to Arizona, yeah.
Yeah.
When she cut out aspartame, she got improvement.
Yeah.
I don't use that, but
yeah, I don't drink diet pop or
right.
I drink a little bit of pop, but
you've gone to beer, right?
Well, I can't drink beer even. I got to turn to the hard stuff, I guess.
Well, this has been a downer for the last hour. I apologize.
I'm sorry about that.
New people. No, it's not you. Aaron, you're just being realistic.
No. I want to ask Constance too. She hasn't been able to share much. Did you have any questions, Constance?
Yeah, please.
Well, I have electrical shocks and burning. And I have a hard time brushing my teeth. I have a hard time putting my makeup on. It's just sometimes I can get it to calm down, but right now I'm having a hard time. But I am taking chemo, so that might be irritating it.
Yes.
You mentioned that. So I'm just working with the medicines and see if I can increase them and get it to stop for a while.
Ask your oncologist if Claritin would be something that you could take because it really.
Well, I will. I'm taking another one, but maybe Claritin is better. I take Allegra every day.
Okay.
Did your problem start with the chemo?
No, I've had this for about 8 years. But you're right. I had Gamma Knife, and it worked for 18 months. I was pain-free for 18 months, and then it started back. And some days I can keep it under control with the medicine. Some days I can't. But you mentioned baclofen. I think I have that. Maybe I'll start taking some of that at night because I know it does make you very tired.
Did they do an MRI and they saw a compression?
They did an MRI and they saw nothing.
Where'd you have the Gamma Knife, Midland or Beaumont?
Midland.
Okay. You know, Dr. Copeland has passed.
No, I didn't.
Yeah.
I was thinking of having the Gamma Knife again, but I just wanted to see if I could control it with medicine first.
They have that at Beaumont now. Back then, they didn't have it at Beaumont.
It's just Midland does $700 a year. The other is supposed to do about 15 or 20 a year. Yeah. That's why I picked Midland.
Yep, you're smart.
Dr. Copeland, yeah, he did an awful. He was very successful. I don't know if Dr. Jones, I think it's Jones, whether he's continuing the success rate, but you've kept up with him, huh?
Pardon?
Dr. Jones?
Yeah, I will have to look at my files and see. You know, they said it would be good for 4 years, but I did get only 18 months. But that could be because of the chemo. I didn't realize that, you know, it's an irritant.
You can go up and talk with Dr. Jones and I think it's Jones.
Yeah.
At Copeland's place.
Okay.
He gets our agendas in that. Whether he reads them, I don't know, but
yeah,
he's continued to read what we sent Dr. Copeland.
Okay.
Dr. Copeland, he spoke to our group every March for 11 years straight. He drove down here to talk.
Yeah, I
passed about 5 years ago.
I think I'll just increase my gabapentin and my Tegretol a little bit. I guess my doses are not as high as they can be.
Who do you get your meds from here?
Well, right now it's Dr. Cole, but I'm in the Dr. Bruce Cole, but I'm going to be changing doctors.
Is this out of Beaumont or Ford?
Well, he works out of Providence.
Providence, okay.
Yeah, you could go up as needed to get the flares under control, and then if that works for a while, then you could talk to your doctor and see what they say about bring it down, or keep it there, and maybe that'll get you through an entire season.
Right. Yeah. Will you be able to be off chemo, Constance?
Pardon?
Will you be able to get off of the chemo?
No.
So you have to work with it.
Yeah. Yeah, no, I get it once a week and for life.
Oh, you are a warrior.
Gosh. Oh, boy.
That is a battle, girl.
I have stage 4 lung cancer, so it's keeping it stable.
Yeah, I think managing cancer now is becoming like a chronic illness that can live with it, which we weren't able to years ago.
Yeah.
Well, and having the two things at one time is kind of hard. You know, it's one thing to handle the cancer and then the trigeminal came back.
That's brutal.
Yeah.
Oh.
That's brutal.
Lynn can talk to you on the side of what she went through. You guys can talk separately if you need to. how she managed chemo and her TN.
And Constance knows a heck of a lot more than I do every week. I only had to have 4 treatments. I'm meant to
I started out with radiation and 2 treatments, and I did go in remission, but then I was only in remission for a year, and then it started back.
So you've talked already, Lynn? Sorry.
We just emailed a little bit.
Yeah.
Okay. Sorry. Okay. Melody, you get enough of that water?
Yep. Yeah.
Everybody's I saw Dr. Rossi had a jug.
Yeah, that's
right. Yeah.
She was keeping herself hydrated.
Rachel, how are you feeling? It's hard to walk into a group being newly diagnosed. My heart goes out to you. I remember being newly diagnosed with the MS, and I just wanted to just scream and cry and run out of the room.
I wanted to run out of the room. I remember the first.
Lynn's a hugger. If we were still meeting at Beaumont, she'd give you one of her big hugs and feel better.
I feel thankful. I have so many notes from today.
Oh, good.
So, and I feel like I do have support now. So, one day at a time, you know.
Yeah, exactly. Don't get ahead of yourself.
Yeah.
You know, you can successfully live with it, and you can find meds that will help you manage it. But being open with there's a lot on the facial pain site about employment and about how to let your, company know and things like that. And I went to school late, nursing school after my kids were in first grade. So it was new to me and I was enthusiastic, but there's only so much you can do. And if you're working with a Fortune 500 company, they can pay disability. I mean,
yeah,
you can afford it.
I'm always like, my personality is to be the hero, take care of everybody. And now I feel like, oh my God, everyone's going to look at me different, my family and friends, because I can't do what I've done.
You got to pace yourself now. Mm-hmm. Slow down a little bit. Yeah.
That's how we added to the note we send out to family and friends. We always used to invite people when we met at the conference room for years at Beaumont. We always had kids. In fact, Donna Duff next to you on the screen used to bring her young daughter with her not that she would understand it, but we encourage people to bring their spouse and the kids, if they're of age, that could understand any of it, so that people around you knew what you were going through. And other people speaking about it seemed to help spouses understand, especially, more of what you were going through.
Mm-hmm. Why don't you speak to that? Are you in a relationship, Rachel?
I'm married, yes.
Yeah.
And my husband did kind of come in a couple times and listen, but he can't sit for very long, so.
It's stressful.
But the good thing, my daughter is grown, because I couldn't imagine, Lynn, being you, having 3 young kids running around and trying to deal with this. I don't know if I could do it.
I had, when it happened to me from a dental injury, I had Natalie, who was, I think, just starting kindergarten, and my older daughter was just starting high school. And I had a very big career. I was an executive for a steel company, and I finally had to give that up because of all the stress of the kids, my job, and my husband was constantly traveling, which is why I used to take Natalie with me to the TN meetings. But it was very hard to juggle the kids, my career, and the pain. So
you're doing a lot of presentations, Donna?
Oh yeah. And
sales calls, yeah.
I had to deal with a lot of customers and suppliers, big steel mills. Yeah, it got really hard, and it was hard to travel, and
I couldn't imagine trying to travel, just because when it flares up, you cannot function. or talk or anything.
It's very hard. And it was a major grieving process for me.
Yeah, that's so true. Like because that's part of your identity.
Yeah. I mean,
and it's part of your support system. Let's be honest.
Right.
Yes.
It was my career for 25 years, and I worked hard to get where I was.
Right.
The level that I ended at, and it was really depressing. I went through depression. I went through grief. And I was very thankful to find this group, because nobody could really understand that they don't have it. They don't understand the pain level. And it's very tough, but I'm hoping that yours is temporary because of the vaccine. I'm hoping it will.
That would be nice.
And go away. Because it is tough.
That's a good point, Donna.
Yeah, managing stress is a huge trigger, because it raises your blood pressure and your adrenaline and all the hormones that we secrete, and that just ups the nerve endings. Like, it makes them fire more. We had one patient who came to us, and she would only get shocks when she would walk. Like, she would walk fast in the morning for her exercise, and that's when she'd get this throbbing pain. Turns out that's because her blood pressure spiked up, and she had a tumor in her sinuses.
Wow.
And they took the tumor out, and she's home free. She doesn't have TN anymore, and she's good as gold. So the people that are able to manage life are out there living it. And the rest of us are trying to pay it forward, because we've all been where you are, and it's so hard.
Yeah.
I'm glad you came, and I hope we didn't scare you away, and I hope you know that you can reach out to any of us, anytime. All of you.
Thank you for
We do
having
love
me.
each other.
And when I can talk, like,
Go ahead.
oh, go ahead.
No, go ahead, Rachel.
Go ahead, Rachel.
No, I was just going to say, in the times when I can talk, like right now, a little bit on the low side, I will be here for you too.
Oh, thank
Aww.
you. You all are. Sarah, thank you for joining us from the UK.
Okay, Annika.
Thank you for having me. I'm gonna have to go because it's 1:10 in the morning, and I'm really tired. What is the time there? What is the time there?
8:08.
8.
Yeah.
So you're 5 hours ahead,
Yeah. So thank you. When do you meet again?
We usually skip July and August.
Okay.
We can always change that, but until we'll meet again in September, I've got to get on the ball and line up our speakers. Usually we have the speakers all set for the year. But we used to meet, and for a long time I had 10 speakers a year. And then we moved to every other month to allow more time for members talking, because if we had a speaker like Casey came, he went 3 hours once.
Wow.
And we never had time for talking between members. And so then we went to every other month. So if we follow what we've been doing, September and November would be speakers. And then December, Lynn always puts on a big Christmas party. It's a little hard to drink through the computer, but she usually,
we'll figure that one out.
she usually has Woodward to be a little far for you to come, Sarah, but she has it. What's the name of that restaurant, Lynn? What's the name of the restaurant? You and Kim?
What's the name of that restaurant, honey?
I can't.
Oh, Chris Belly's?
Belly's.
Yes, thank you. Between all of us on all these meds.
Natalie was there too.
I have no excuse. So
Anyway, yeah, the last half hour or so has been a little more negative. But like Lynn said, we're always available to talk. I want to send you, Rachel, that book. If anybody else needs it, I think I might have at least 10 of them or so.
Rachel also asked if you could send her your synopsis of your history.
Rachel.
Yeah, that I'd like also, if I could get it, please.
Anybody write me that needs a history, because I don't have. I have your emails.
Raise your hand so we can write it down. Who needs it?
Hey, Tim, would you
send me the book also?
The book. Can you email me your home address?
Oh, yeah, I think you have it.
Can I say that Tim's history helped me a lot with me making my history up to give it to a pain medicine doctor. It helped a lot.
Yeah.
And
he did a great job. And I went right off of his way.
I've sent that to over 1,000 people around the world. We used to have a
great
called American Society for Action on Pain, and it was around the world. And another one, TNA, and they've kind of died off over the years. So, anyway. Please email me if you want the history, and then I'll know who to send it to.
Okay.
If you would, thank you.
I'm going to have to go.
Yeah.
Bye, Sarah.
Bye.
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 Thank you. Bye. Bye.
Bye.
Bye.
I think you have my email address at the bottom of the note I sent out.
I do.
Tag you to WebTV.
Take good care.
Peter, do you need everybody's email address?
We're looking.
I've got them. Well, Pete gives me the ones that might be new. They wouldn't be here unless.
You don't need mine, right?
Yeah, I don't have names next to all of them. Is the problem? We've got over 300 members.
Okay,
so
gotcha.
Wow. Rather than have
all their home addresses.
Rather than have the inconvenience of people registering for each meeting, we're trying to get folks to just type in their email address. That'll show up in the chat list. Then Tim and Lynn will know.
Gotcha. You have us old ones.
Then Amy,
right? I don't know what he just said, but
yeah, we have Rachel's and Amy's and Constance, and then
I all had all of your email addresses because I sent out the note. But if you'll let me know who wants the history, I'll send it to you. Sorry, I'm losing my voice too. It was bad to start the meeting. Anyway, thanks, guys.
Thanks so much.
Right,
thank you, everyone.
Thank you so much.
Linda, you doing any better at all?
Pardon?
Bye-bye.
You doing any better at all?
No, I'm not doing very well.
Should I worry about?
I don't have much support. I'm not doing well.
I know it.
Linda, where's your daughter?
She lives in town, but she's got 3 small children, and she works full time down at the Indiana State border.
Do you have a neurologist to see, like Rossi?
I do have a neurologist, and I wanted to set up an appointment. And she just tends to want to communicate online or on our hospital line, but I don't know. I just feel like I'm not getting any better. I'm getting worse.
Would you want to come and see Dr. Rossi? I'll come down and pick you up and bring you over here. You make an appointment. You've got her phone number in my note.
Yeah, I might have to. I don't know. I mean, the lidocaine is not working so much anymore for me.
I just feel some low dose of opiates should be tried. Whether we could get Rossi, she told me recently that they're grandfathering the ones that are getting it. Maybe I could talk her into letting you get a low dose of opiates. Even normal start or something.
Yeah, I don't know what to do. I just don't know what to do. I'm starting to get, I don't have the triggers anymore, which is really good. But
you don't have the double vision anymore either.
No. So that's been corrected by U of M. But I believe they've done so much damage to the nerve. I'll never be the same. I'm just not doing well.
That's why I worry.
How can we help, Linda?
Yeah. That's why I said I'll come down and pick you up and take you to Dr. Rossi, and we can see if she can come up with something.
I try to be strong in an island and a woman of faith, and I just...
No, it'll wear you down, Linda.
Yeah.
It'll wear you down.
You've been,
We've all been there at different levels.
I know. I don't know. I
you tried going on the Facebook page, the Facial Pain Association Facebook page?
I did not try that yet.
You should try that, because there are wonderful people on there, and they're all it's the official Facial Pain Association group.
Okay.
And there are just some, Aaron's on it, Donna's on it. There are some really good people, don't you think, you guys? I see. We had a
you get a lot of people looking at your post and trying to help and trying to give you different ideas.
And it ends the isolation. You can always go on. And between the pandemic and chronic pain and all the stuff you've been through and your daughter being really busy and life goes on, you know, that's hard. But I would encourage you to get on Facebook on the official facial pain group, because we're on there and there are just so many good people out there. I mean, lifting each other up. I mean, I'm just amazed. There was a young mom on there with the only child of 19 that had this terrible TN, and he had surgery, and I forgot what happened to him. He had a bleed or something afterwards. I mean, they had people coming out of the woodwork to help this mom. She was desperate, and it was, and you see this kid rallying, and it was just encouraging that there's that much love for each other out in the world, that people were going to love you up, Linda. You're a lovely person, and I'm sorry you're struggling. It's really hard.
Thank you. I just don't know what to do. And I used to have the attitude, buck up, buttercup. It's not working anymore.
No, pain is exhausting.
Yeah. And I don't get 1 minute of a break. Not 1 minute.
Yeah.
Not 1 minute. It's burning. It's electrical. It's almost like someone shoved a screwdriver in my eye. I mean,
They tried
that Michigan helped you with the eye.
Pardon? Oh, I am so grateful. And originally I told the Lord, I said, if you can fix my vision, that I will be forever grateful. That's enough. That's enough.
The double vision, not the pain.
Yeah, that sent me right over the edge when my world was so distorted.
Right.
And,
and you're grieving. You're grieving the loss of so many things. You know, you were a nurse caring for all these people in the world, and now you're on the other end of it, and it's a loss.
Yeah, and I don't know if I have anesthesia dolorosa, but I have complete numbness, complete pain. I'm now questioning if I'm having trouble swallowing on the left side. I have no taste on the left side. I have no more tears on the left eye, no sensation of my left eye. I feel like, well, I have had a stroke, but I feel like a stroke victim per se, just with all the sensory strangeness, you know.
Chicago didn't have any more answers for you?
Pardon?
University of Chicago, the people that did the cyber, they didn't have any more answers for you?
Oh, they wouldn't even answer my calls when I called them. No.
Yeah, it really gets under my skin.
I really almost considered litigating, but I'd have to get a Chicago attorney, and I just thought I can't go through that battle.
And then you won't ever find a good doctor because no one will take you.
Right. So no. So I've learned to let it go. But maybe I need to just compose a letter to the surgeon. I mean, I had a nerve that needed to be decompressed, and he messed around with it, and he did more damage. 2 rhizotomies and high-dose CyberKnife. I really feel if I had found Dr. Casey and had my surgery, I'd probably be a whole different woman right now.
Yeah. But you know what?
Dr. Casey, then
nerves regenerate, though, Linda, and you've got a lot of numbness now, but that doesn't mean it's going to be forever.
Okay.
I would hold on to hope, kiddo. Keep walking that puppy of yours. Get outside. Take in nature and get your mind distracted by something else. It's not going to take away your pain, but it's going to get your mind to concentrate on the beauty around you, and it will help your endorphins and all that other stuff that will make it easier to cope. It's no easy feat.
No, and really, I'm worse in the evening. I'm much better in the morning.
You're not as tired.
I'm not as tired. Yeah, but evenings are never so good.
Yeah.
Mm-hmm.
Maybe we need to have a Zoom meeting with you every night. Buck you up.
Yeah.
Thank you. You guys are wonderful. I'm so glad I found you.
I'm serious about seeing Rossi, though. I'm not on all those things Lynn's on. So I support Lynn and what she's saying. You're just going through the 4 or 5 stages of grief, which we all go through. And, at some point, especially when you're living alone. Those are the ones I really worry about. Most of us have somebody that we're living with, like Pete and Donna for me, and Donna's husband. Aaron's Danielle. We've got people that we can talk to when we're in pain, or go and get us an ice pack or something like that. You're living alone, and apologize that I haven't gotten a hold of you more than just our monthly meeting.
No, that's okay.
I didn't want to put you on the spot anymore, and I did.
No.
Just to let people know. Stay
and
away.
I'm like a wounded dog. I retreat, so it's partly my fault.
Yeah. I apologize for putting you on the spot, but
it's totally normal though. And isolating is how we're trying to regroup ourselves, right? It's hard to get out there.
Exactly what Rachel was saying too,
Yeah, it's very hard. I'm glad you guys all supported her. I could see her face dropping with each thing, and I was like, oh, what have we done to this poor kid? But it's tough.
Yeah, she's probably the youngest one on.
Yeah, we wanted to take a moment just to acknowledge the passing of a really great guy, Ken Chilinsky. He used to come to our Beaumont meetings, and he'd sit along that chalkboard wall. He always had a baseball cap on. He was the big, he loved Jesus. You remember him, Aaron?
No, I'm trying to remember him.
He had anesthesia Doloroso. But he
80 now.
Yeah, but he got a UTI and then some kidney issue or something, and then he passed. But he had anesthesia Doloroso. But you know what? I talked to him at Christmas time, and he was turning 80, and he was in the best mood ever. His pain, even though it was brutal, like when he returned to Beaumont, he had managed. It got better as he got older. It didn't get worse, and he was able to manage it with medication that his own general doctor gave him. So there is hope, even if it is anesthesia Doloroso, that it may change as we get older. Like the nerves just tire out of telling us that, we're in agony for so long. Maybe we adapt to it, or our sensation level changes. Or don't think it's going to be this bad forever, because it's not. Just can't.
The one thing was under other facial pain issues, Lynn came across an article, was too long to attach, but it was how to describe medical symptoms to your doctor, which ties in with my ATN history. That thing went on. I think Lynn had 14 different attachments. I didn't read the whole thing.
That was because of the stupid ads that they stick in there all the time.
But anyway, that was something I meant to highlight when everybody was on. That's something that Lynn picked up, I think, is especially if you're just trying to find a new doctor. It had a lot. The first page I read, I knew it was worthwhile mentioning. Well, Lynn asked me to do. So,
well, I would like to read both. Lynn, do you think I'm not managed well with my meds? I mean, I'm on not a lot, and
I don't think that. I think they tried so many procedures because they didn't want to put you on more meds, but I think you need to increase your meds. Especially after what Dr. Rossi said, that's just not.
What are you on again?
I'm on Lyrica 50 milligrams 3 times a day, Baclofen 10 milligrams 3 times a day, and Trazodone 25 milligrams at night.
Yeah, that would not touch that kind of nerve pain.
It doesn't. It doesn't.
So how can you?
We backed down on the Lyrica, the baclofen, because I thought it was making me quite mentally dull, and I was almost falling. And
you don't need that. The double vision. So
no. U of M said it was not the double vision. They said
no. I was worried with it. They didn't say you had double vision.
Oh, no. U of M said it was not the double vision causing me to fall. It was my meds. And so they backed down on my baclofen. She went from 60 to 20. And then I thought, I can't do this. Yeah.
But that one you should probably just take at night.
The baclofen?
Yeah.
Yeah, if it makes you that way. Yeah.
It what?
If it makes you feel that way, baclofen.
Well, I've gone from 60 now to 30 milligrams a day. So I cut the dose in half, and that is, I'm not falling.
That one was making me so tired.
Yeah.
I couldn't even drive.
Yeah, it does. I mean, I would go places and want to fall asleep.
Yeah. That one I would recommend just to take when you at nighttime.
Mm-hmm.
And also when you're that tired, and then that affects your mood.
It does. I've gotten counseling. I've reached out and done all the appropriate things.
Yeah, you have. But I think
but I just feel very much struggling, and I'm not struggling as bad as I was probably a year ago, where I thought I don't want to live anymore, but now I do want to live.
Is Michigan giving you the scripts?
Is what?
Michigan giving you the prescription?
Yeah. Mm-hmm.
So you've got a neurologist there?
Yes. Mm-hmm.
You're comfortable with them?
I like her somewhat. I don't know. I mean, yeah, I like her, I guess. I just don't know. I'm gonna get a hold of her online tomorrow and say, listen, this is still really bad. What are you thinking?
Yeah.
I also have a pharmacist at my internist, and I sent a message for her.
Oh, that's a really
Can
good.
we do anything else? You know.
Yeah. Pharmacists are the best. They understand the meds so much better than the doctors have time to investigate.
Right.
Have you ever considered opiates? Have you asked the doctor about that?
I don't know. That would probably prohibit me driving again, and then that leads into the social isolation again, and maybe the lack of trust with my daughter being able to be with the grandchildren. I don't know.
Well, I've never stopped driving. It hasn't affected me at all. Maybe I'm one of the unusual ones, but your system has to get used to it.
Right.
A lot of us here.
Yeah, I can drive.
Yeah,
Can you drive on the opiates?
They have pilots on opiates.
Oh yeah.
Right.
Sometimes the other.
I think I'm just so hard on myself.
Well, people are afraid of them initially.
Mm-hmm.
And all the anti-seizure meds, I'm on, 3,000 milligrams of Keppra a day, and the opiates, I can still drive.
Okay.
3,000 you're on? Yeah.
Yeah, 3,000 of Keppra.
Well, most doctors give you the opiates. I mean,
no, most won't, but that's why I said to ask.
Yeah.
She hasn't brought up the level of her regular meds yet to consider opiates.
Yeah, I need to
try to get those up.
For that.
Mm-hmm. I need to try to readjust those.
She was at 60, and it made her too groggy, so they backed it off to 30. This is a typical story to me. I don't know about you, Lynn. Doctors that are afraid or can't give opiates, they run you up on anticonvulsants till you're so stupid you don't even know your name.
Yeah.
And what you do is you lower the anticonvulsants and then try the low dose opiate. I can't count for people that I've run into over the 25 years or so.
Yeah,
that was Leininger's. Play the whole time.
I mean, it'd be nice just to be comfortable in the evening go to bed
what I'm
with
talking
less
about.
pain.
And
I had a woman in Australia. It took me a year to convince her to even ask her doctor about opiates. Finally, I sent her something. She asked him, and he said, "Oh, yeah, why didn't you ask me?" She only took 50 milligrams of morphine, and it changed her life after 13 years. Diane O'Callaghan, I remember that. This goes back 20 years. But that was one of my first ones. And then since then, you know, I'm not bragging. I'm just trying to tell you that I've worked with over 1,000 people around the world. Not all of them have used opiates, but at least have given them my summary, and they can talk to their doctor about it if they have the right kind. You have to have constant pain before you take it, because there has to be pain. I'm using layman's language to offset the strong narcotic. But even if you started
all the time,
10 or 20 milligrams,
that's it.
just to see if it touches it. And then if it touches it, if you get the right type doctor, then they'll titrate it up. It took me 4 months to get to it. It was 480 back then, to a certain level.
And I didn't even need that much. I think I started out at I think they had 5 milligrams way back when.
Yeah.
And I was on that for a long time. Then I went to 10, and now I'm at 15. I've had it for 25 years.
But you didn't have a cyber knife either that damaged your nerves. So
right.
That's why where it hurts is so bad.
Right. But it's encouraging that Ken's got better. And his was really bad, but
on opiates, yeah.
Yeah, no, he wasn't on opiates, I don't think. Ken?
Yeah, he was on morphine.
Oh, was he? Okay.
Either Oxy or MS Cotton, one or the other.
Okay.
Oh yeah, I talked to him a lot about that.
Yeah.
Yeah.
I just mentioned that when my doctors tried the Tegretol, the Lyrica, and the Neurontin, it made my pain worse, and I was allergic to them. So I don't know you never know what really, even I told that to Dr. Casey, and he said, yeah, that can happen because those medications are messing with your nerves. So sometimes they can make it worse.
What did you go on then, Donna? You went on an opiate, right? Which one did you go on?
The MS Content.
That's what I thought, yeah.
Because I went to see, I finally gave in. I was trying to not get on anything like that because of the stigma and how you're feeling. Like, you don't want to tell your daughter, have her worry when you're with her kids and all of that. I was the same way. I didn't want that stigma, but I find Tim actually talked me into giving in and trying it because I could not function with that pain. It was horrible.
And nothing else touches it. I mean,
nothing else touches it. No, they'll try. Nothing else touches it.
Not when you've had it this long either, I think.
No, I've had it now for 21 years, and it's like, I did get a reprieve, from the microvascular depression. But right now it feels like someone has taken a baseball bat and knocked out my teeth right now.
What year did you have the cyber?
The cyber was it was 2 years ago.
Did they know where to go if they didn't see anything on the X-ray, on the scan? Didn't you say you had a scan and
they'll go rest?
I did have a compression, but I had the nerve was being compressed by two different parts of the artery looped and pulsating on it. And then the second time after the surgery, they put the padding there to decompress it. The padding was on the dura, and the dura recognized it as a foreign body. So then it congealed the padding and choked the nerve. And then the titanium plate that they put in Pittsburgh was compressing the whole thing. So I was so miserable. And when Mayo turned me down and I couldn't find anybody to help me, I just didn't want to live. I didn't want to live like that.
You had the MVD in Pittsburgh?
The original one.
That was with Sakula or Janetta?
No, it was Dakula, I believe. Yeah. Yeah.
When Dr. Casey did you get any relief from the second?
I did for a while. I did for maybe 6 months, and then it started coming back, and it was really awful. And it just, yeah.
Have you been in contact with Dr. Casey? Because he does a great job by email with his patients.
No. Like I say, I isolated myself like a wounded dog.
I get that, Linda, but I would reach out to Dr. Casey because he really will email you back in the middle of the night. I mean, he really gets TN. He was right there with Dr. Janetta when they, when he first, did the MVDs in the very beginning. So he understands.
He won't give her opiates, though, I bet.
But he would have some recommendations for you, and he would recommend maybe another neurologist that's in Kalamazoo.
Okay. I will email him with a description of my discomfort medicines that I'm currently on and see if there's anything else that we can do, because I can't do this anymore.
No, get out there. Get out there. You got this. I'm so glad you joined us. I'm so glad you came.
Thank you. So I need to reach out to people.
Yeah, you do.
Not being an island, I can't
live with this kind of stuff alone. You just can't.
No, I'm used to taking care of people, and
it's tough. Yeah. And the pandemic has made it that much harder to reach out and get the support that we all need.
It's almost like it was a good hiding place for me. I didn't have to make excuses as to why I didn't want to do anything other than take walks alone or whatever. I literally, as it was lifting, I'm not going to say it's lifted, as we're going out inside or whatever, it's not cold here now. It's almost like, I don't know, people are talking, let's get together. I don't feel like it. It was a good hideout for a while. It sounds a terrible thing that happened to the world, but it was a good hideout. And I have to admit that I looked at it as that for a long time.
You live alone, Amy?
No, my husband's here. He's very good about it. And like, he can look at my face some days and just say, I know you're having a horrible day. And sometimes it's the weather, and sometimes it's just, I don't know what it is, that it's worse. And I do have the low dose of the immediate release oxycodone. It helps. It's very fast though. It's gone and it works.
So you don't have OxyContin? They just gave you the breakthrough?
They had OxyContin a long time ago, and the price went up so high, and that was the end of it. The new doctor wouldn't even forget that insurance, even if I paid.
Well, try morphine sulfate. That's gone generic. That's gone generic. And that's worked for me 25 years. And same with Donna. She was on MS Cotton. Then it went generic in July of 2017. Ask for that.
Okay.
Yeah. That's a great
MSIR is for breakthrough pain.
I know. As soon as I got started, that doctor unfortunately passed away, and he was wonderful. He had a name, and he was knew what this was, even though he didn't really have a lot of patients, probably any patients. His training, I guess, taught him. He wasn't a newbie in the management department. But it seems like everybody after him is new, and they leave because it's like they're not happy with the management, and it is all management now. It's all some kind of managed care, and I've seen 3 doctors come and go in the last 8 years I'm with them.
Where are you located again?
Long Island.
That's what I thought. Yeah.
You would think it would be a hotbed for, people knowing things, but everybody seems to be everywhere else. Like Dr. Casey, I remember reading about years ago. Nobody in New York is really knows about it or wants to know about it. It's just trying to find out. Like I keep saying, I want to know what's crushed in here. Is there something crushed? And that's what I asked the Dr. Rossi here.
Right.
How could you not know? How could they not have some kind of picture like that would show? Because I would pull out every tooth, but when I did, it moved to the next and the next. And after 3, they said stop. My goal was always to put implants back in because you don't want to have nothing. And I just ended up stopping at 3, but it's sitting in the next one, and I could swear if I pull that one, it will work. But they say it won't. So I'm
just as info, they wanted to put 4 implants in me because my jaw was so strong. Number one, it probably would have cost me 10 or 15 grand or more, but I had the rest of them just taken out in the top, and I have a complete denture, which I tell my wife, it's great. You talk about cleaning your teeth, you just pull the whole thing out, pop it out.
But are they comfortable? Like, is this
not too good for kissing, so I got to put it in when I kiss her. But other than that,
they don't hurt. They don't hurt on your gums. They don't hurt.
No. Gums have gotten used to it, and on the lower, I have a partial that covers probably half the teeth.
And the
partial. They can help for everybody if they want to see it. I think I'll see it.
That partial, see, that's where I want a partial, but I have so much pain there that I think if I put a partial in, it's just going to be sitting on the
my trigger point is right here. We think my V2, the infraorbital branch off V2, is what is damaged. It was a molar right here, and I had a root canal. I don't know if he went too high. I might have left it too long. My dad was dying of cancer in Flint at the time. And I was driving back and forth, and I might have let it go too long. But anyway, they finally found that the infection ate through that sinus bone. Lynn's an expert. I think that's a maxillary bone. And it was dumping. I had 24 bouts of sinusitis, bronchitis, pneumonia in a 14-month period. We figure that infection got to that infraorbital branch and damaged it. That's where my trigger point is. And fortunately, the full denture does not cause more pain when I have it in.
Oh, you're lucky.
I don't know why. Why.
I can't even go near the extraction site of where they pulled my tooth out. You can't touch it.
You had one tooth out, and that's where yours started with.
It was from a root canal. Or first, it was a really deep filling that the dentist removed, a mercury filling, and wanted to switch it out. And then I was in so much pain after they took that filling out and replaced it. And then they gave me a root canal, and then they missed a canal, and then the infection went into my jaw, and then they retreated the root canal a second time, and then I was still in so much pain that they finally said to pull the tooth out. So we pulled the tooth out, and then it got 100 times worse, the pain, after they pulled the tooth out. And then it goes all the way to these teeth at the bottom. And I keep saying in the front bottom, like, there's something wrong with my front bottom teeth. Like,
look at it, please. There? I'm begging to look at. Find something to look at it with. Like, how could there not be a scan in this world that could see what's going on?
Back to that issue, I asked my brother-in-law that. He was a radiologist, head of the Radiology Association in Wisconsin. And what he told me is their scans cannot see the infection, but they can see the damage that the infection does. That's why I asked him. I had nuclear tests at Mayo Clinic with him in Wisconsin. Nobody could see that hole in the sinus. I even had an ENT do surgery. Well, I don't know if it closes up or what the hell, but they could never see it. So it was all describing the symptoms. Finally, the doctor at Aaron and I have been talking about this at Emory, did what they call a thermogram, and he checked the heat on each cheek. And one cheek, I think, was colder or hotter than the other, and that's how he finally diagnosed that the nerve was bad. And
oh wow!
Finally recommended strong. I forget what it is, 800 milligrams of something. And I said, "Oh, we already tried that." Then he said, "Go to morphine or methadone." And my doctor here at Beaumont had heard him speak around the country.
Wow.
We went right to MS Cotton. So fortunately,
You're so lucky.
I remember mine. I was in Australia when mine blew up at one time. Didn't know what it was. And so I can relate to people trying to be in a management position or sales, trying to talk with people. And that's why.
Yeah.
But you got to be honest about it. You know, the doctors used to say, "Do you ever think of killing yourself?" I put, "Damn right." You know, you can't soft soak this thing. If you feel like you'd rather be dead, you got to tell the doctor that. You can't bullshit them, excuse me.
But they're
flint language here. But you got to be honest with them and tell them how damn bad it is. One doctor had that, Dr. Mearshart had that on every time he came in. "Do you feel like suicide?" or something like that. I checked yes, because they did.
interesting because you think they're going to stay away from the
Yeah, otherwise they think they look at you. It's not like you got a broken arm.
No.
Nose.
It's the thing, you can't see it, and
No, you can't see it. It's
people don't even.
I said earlier, medical books say it's the worst pain known to mankind, and called the suicide condition.
Yes.
And Lynn and I have had 3 ladies with suicide, and I'm not sure it was all related to TN, but they had bad TN. Yeah. And we've gone to 2 funerals. The 3rd one we didn't. But
I always wonder if I get sick with something else, how would I handle this pain? I just like with the chemo. I mean, I can't imagine having that and having this. It's just too much to do to a person.
Yeah. I think one of the persons we talked to went to the street. She was finally, remember Lynn? She and her boyfriend were getting meds off the street before she passed.
Oh, yeah, I know who you're talking about.
The one on the east side.
Yeah, that was
a shame. It shouldn't happen. It's all these changes.
I forget what she was getting. That might have killed her there. That might have overdosed.
Right. The wrong thing on the street. That's the problem.
Well,
I'm not recommending
that stuff there.
Especially today with all the fentanyl out of China. You don't want to be touching stuff off the street.
No. Hey, Amy, I found you a support group in Lake Success, New York. I don't know where that is. Do you?
It's near me, yeah.
Is it? Okay, I'm sending it by private, by the chat box.
Great, Lynn. Does it say where it is in New York, Lynn?
Lake Success.
Near me, yeah.
I know, but what area of New York?
Wait, will that stay up for a minute while I write it down?
Yeah.
It went away. It just went away.
Oh, you're putting it in the chat?
Yeah.
Okay. I don't even know how to pull that up.
Oh, maybe if I.
Chat's on the lower bar of your screen. You just circle your mouse over it.
Chat box.
That's what I'm looking at, but which one's chat, Pete?
It says chat.
Swing your mouse around. Chat's in the center. It'll look like a little bubble.
I see the chat bubble, but it's giving me.
Oh, no, something was in front of it. There's 17 items there now. Mine.
Yeah, I am a get
go to like more.
There, went to the side. Okay.
Can you see it on more? Under more, can you go get to chat?
Van Allen, Richard Van Allen.
Yeah, Richard Van Allen, 516-442-2250. And I don't know why he's got times 110. That must be an extension or something.
I see, Pete. You asked everybody for their good job, guy.
Thank you.
So give me a call.
I've been Googling and Googling. I
am Dr. Rossi.
You have to go to the facial pain, like facepain.org, and you look under support groups. And
that is how I think I found this tonight. But
oh, good. I think they had a list of the support group meetings, and if you clicked on it, Erin, that's such a cute picture of you with
this one didn't come up. The Lake Success, like I saw the New Jersey, I saw California, I saw everywhere, but
maybe they're new. We're going to San Francisco next week, and I'm going to try to meet with Susan Mills because she runs a group there, and it's just nice to see people face to face. I still remember the first time you know, I saw another person with TN. Like, you don't believe that they're living the same nightmare with you.
Yeah.
Amy?
I'm gonna sign off and go to bed and
feel better, honey.
Back and walk my dog. Yeah.
Thank you. Want to come down here?
Yeah, I think I am too. I'm gonna.
Thank you so much. You've
Thank
helped.
you, everybody. Thank you.
I'll get moving on things.
Yeah, good, Linda.
All right. Thank you.
Good night.
Bye-bye.
Yep. Bye bye. I've got to go too. Yeah.
Does
Good night, everyone.
Thank
you. Go too.
All right, I'm going to email Tim for that.
Yeah.
Amy, I also put on a private chat to you a Facebook group, support group that has similar to what if you have what I have. It's all about dental caused, like the teeth issue and dental procedures that have caused it.
There's one specific to that. I feel
yeah.
I don't see it up here where
I sent it on the private chat, but I'm not sure if you saw it. I can resend it to you.
Private chat. So it would be.
It still comes up in the chat box. It's just.
Yeah. It should be above what Lynn sent you. That's where I found the lady from UK that was with us, Sarah.
Thanks, Donna. You and Lynn keeping your eyes open out there.
I'm not finding
it. Great job.
Okay, let me resend it to you.
Pete, does that chat disappear, Pete, when you shut down?
No, it's actually you'll have a transcript if you want it.
No, I'm just writing some things down.
Yeah, I can send you the transcript afterwards.
Oh, that's
where would I find a private chat message?
It'll still come in the chat scroll.
Yeah. The last thing I see is yours, Lynn.
Did you send it to Amy, Tina?
Yeah. Hold on. I'm resending it to see if she can see it.
Oh, okay. I think because it's up. Okay. So how would I get you?
You could, Donna, I could send you Amy's email address if that would help.
I just don't see where I would go on Facebook to find that.
Well, you just search. Well, I can even send you the link.
Yeah, that would really help.
I would appreciate it so much. I'm seeing that the wording, but nothing, not a name of the Facebook group. Oh, that is the name. Okay. Wow. All right. Those are words from so long ago too for me. The odontoglia, if I'm saying that right, I can't believe it.
Yeah, and now I lost Zoom.
Donna, I sent you Amy's email.
Okay.
On a card by text.
Yep, I got it.
Yeah. Thank you so much. Amazing.
And
is that Renee, the Cracchiola? It's our Cracchiola. No. Is that Renee?
That was Rachel.
Yeah, that's Rachel. That was
Renee was Renee.
Yeah, Renee.
I meant Rachel. Yeah. Sorry.
Yeah, Rachel is
one in New York.
She's a H last name. She must be using her
Arzuski. That's Arzuski at Yahoo.
Yeah.
Yeah, she must be using her maiden name.
Yeah.
On one of them, anyway.
Yeah. All right. I think.
Thanks, Pete. I've never used this chat thing before, Pete.
Yeah, it's a lot to manage.
Great. I saw Dr. Rossi's note down below to mute Karen. Karen's never done this before.
Oh, did you see her husband's leg? I was dying laughing.
Well, I wondered what that was. I couldn't see what it was.
It was so funny. And her mom's
Rick's leg.
Yeah, and Andrea's like looking like this, like, oh dear God.
Wrote Karen, she didn't see it. Well, it's my fault. I invited Karen.
Well, if she had sent me a text, I would have shut the video. I just didn't want to do it arbitrarily.
Yeah, no, I understand. You can do it. I'm going to call Karen and tell her why we did it.
I wanted to sanction that, Tim, so I didn't get busted.
She's a close friend. Yeah, she'll understand.
They're putting in the no-no corner.
You see that Dr. Rossi put ha after it.
Oh, that's funny.
That was his leg? That was Rick's leg?
Yeah, it was.
It was a blur on my screen.
No, it was a whole leg with a foot. Amy, my folks grew up in Allentown, so very close to New York. That's where we went every summer.
Okay. We were just up in, oh my gosh. Where'd we go last week?
I know, it's ridiculous. Part of it's aging, though. It's not all TV.
I hope so. Oh my God.
Not all medication.
We wanted to grow old. Now, wait a minute.
Give Julie a hug for me.
The other side of the river is New Jersey, and then New Hope.
Okay.
We were in New Hope. I guess it's not too far from Allentown, is it?
What's it?
We were in New Hope last week.
Is it Pennsylvania?
Yeah.
Okay.
Oh, I thought it was close to Allentown, but maybe not, I guess. No, you're further north, much further north.
Yeah.
North.
Yeah.
You both, Lynn, you're going to San Francisco next week?
Yep, we sure are.
Give your Julie a hug from me. I only met her once during WD, but she's a sweetheart.
Oh, we're so excited. Do you have any
baby? What?
Do you have any grandkids yet?
I can't hear him.
Do you have any grandkids?
No, did your daughter have the baby, Lynn?
No, she's not due till September.
Oh.
Yeah, end of September. No, I was asking Amy if she had any grandkids.
July. In July, this coming.
You're an expectant grandma too? First time?
Yeah.
Oh my God, we can go through this together.
I'm like excited, and I keep enjoying that, but then I think of this and how tired and how watching and how
I know
it's crazy, but this happens to everything that's good. I stick this with it. It's like
right. You got
the first thing that pops into my mind is I've got to be like on, and I keep saying that's what I say because you have to. I don't want them to know I'm always doing this. I think they forget I have it, and I want them to forget I have it.
Right, but you have to be realistic that. We're only human. We're all broken.
I can be like really cranky with it, and I don't want to be
What's
with
your
them.
delivery date, Lynn?
What?
Lynn, what's your delivery date?
September 24th is when Julie's due.
Back out for the delivery?
Yeah, we're going to go out there. I don't know exactly how.
Yeah.
Congratulations. Is this the first one?
Yep. Yeah, us too.
Congratulations to you both. Yeah.
Yeah. Is this daughter or son expecting?
Daughter.
Oh.
I'm having a daughter. She's having a daughter also.
Is she? Oh, she's having a girl.
Yeah.
They don't want to know. We're not.
I didn't ask. Was like told right away, and I was like, oh, okay. So now I ask. But,
do they live around you or no?
Yeah, they're in Manhattan, so I'm about 40 minutes.
Oh, that's perfect. Ours is like 4-hour drive or 4-hour flight, but it's all right. They're in the country.
That's right, exactly. That's right. And we can fly again, so that's good too.
Did your daughter get the vaccination or no?
Yeah.
Yeah, mine did too. I was so glad.
First, the doctor said not to, and then as time went on, he said get it.
Oh, that's awesome. That's so wise, because then the baby can be born with antibodies.
Right. So I think he had to see other doctors doing it and see what was happening.
That's fantastic. Well, congratulations. When is she due?
What?
When is she due?
July 2nd.
Oh, wow. It's coming up quickly.
Oh, I know. I'm the one testing now. I'm like, what can I do? I can.
It's wild.
In the house.
Oh, that's so cool.
Yeah. Thank you. Enjoy.
Hopefully it will distract you from the pain.
Exactly.
It definitely makes you pick. I'm sure everyone knows you pick and choose when you can go out. It's like, if somebody asks me to do something, it's like, okay, I'll plan my medicine around it, and I'll plan.
That's the truth, and then you're tired after you take it, and you gotta whatever.
Everything is around that, and it's not what you should be thinking of.
But we're here. We're still here.
It's a long battle. It really.
Yeah.
Like I said, when I was in my 50s, I didn't think I'd see 60s, and here I am.
Yeah.
It was a long road, and I can't think, like everybody, how much pain was in between it, and it's still there. I can't believe there's something like this. That's what's amazing.
Yeah.
How we went through life not knowing about it until we had it.
Did you see it though on 2 TV shows that we watched?
Really? Regular
Chicago Med, and what was the other one?
Good Doctor.
Yeah, the Good Doctor.
The Good Doctor. Good memory, honey. Yeah, it was on 2. Yeah, you got it. You got it.
I like my TV shows.
Yeah. What's the other one? The Good Doctor and
Chicago Med. It's really high quality television.
It's how we zone out, you know.
A lot of television.
Those are my favorite.
Our night soap.
Yeah.
I'm good with it.
So much television.
Yeah.
Really admit it.
Stay safe. That's all we
Although I'm never going to the hospital, Chicago Med. That when that klaxon goes off, you're gonna die.
That's it.
That is not a hospital you want to go to.
Is it real?
Well, there's 3 shows that night.
Oh, that is a real show, right?
No. It's just the drama is just a bit over. They have this horn that goes off.
Fire.
It's
the
the klaxon of death. It just like, man.
You tape those?
When the cars pull up, or when the
No, in the rooms. This little goes off when people go into arrest, and they rarely survive. So it's a weird.
You guys watch Amsterdam?
Yes, I watched that too.
Oh my God! I predicted.
Don't tell us. We take it. We haven't heard it.
I have to watch that one tonight.
Yeah, you gotta watch it.
I have a new one to watch.
A couple months ago. Yeah, it was great. I don't think that's the end of the season.
Yeah, but it's not the end of the series because they are filming a 4th season. So.
Oh, you think this is the end of the season?
It's the end of this season, but.
Who is it? We didn't know that.
Yeah, they'll film in September. You know,
it's a great ending. I figured it might be the end.
Oh, that's good.
Yeah.
No, they'll be back in September.
Oh, okay. Yeah, that's one of Donna's favorite.
Oh,
I like that one too. And Grey's Anatomy.
Yeah.
I never got into that one.
Yeah, I like that.
We watch them all.
Yeah, we're bad.
It takes your mind off things.
Yeah.
Yeah. You're not going to watch the news all night. That's for
sure.
You got to get out of your head. You really do.
Yeah.
That gets you really tense.
Your pain is still bad, Donna?
Mine?
Yeah.
Yeah, off and on. But I mean, it's a lot better than it was when it first started after we figured out the right combo.
Who are you getting it from now? Your GP?
So my general doctor passed away from COVID in January. I was with him for 30 years, so he trusted me because he knew he went through the whole thing with me.
Right.
After Valorand moved, he took over what Valorand was doing, and now I brought my whole history to the doctor in Columbus, that the general practitioner in Columbus that we use, and so now I have to drive back to Columbus this weekend.
Yeah.
You have to go every month, or do they do?
He has me come every 3 months.
3. Okay. I was going to try to get you with mine, but now I know why he wasn't taking any more patients.
Yeah.
Because of the ALS diagnosis.
I just have anxiety all the time about
refills.
If the doctor will continue, or is the DEA going to come after him? Or
ridiculous. For the little bit I get, that's what I worry about all the time. And the Klonopin I'm on to relax the nerves. It's like, are they going to fill it? Are they going to be in?
Yeah.
Is it be a weekend? Is it going to be? Is the pharmacist going to be nice this week, or saying
right?
The truth.
I always have anxiety about that.
The pharmacists give it out before, if it's not like they don't order it.
Right.
Give it to the first person who comes, and then
right. And you've been taking it for how long? And it's not.
And they'll just say sorry, get through the weekend.
We have to order. Yeah. Seriously.
There's something wrong with it. It's really bad. It's condescending, and the whole thing is anxiety ridden, and
yeah. Especially when something else goes wrong. Like I ended up in the hospital because I thought I broke my back again in January, and the only reason I didn't run out of meds when the meds weren't being filled properly was because I had been in the hospital a couple days and had their oxy. Otherwise, I would have been totally out. It's like, you can't do this to me.
It's not right. No.
But this time he had it ready and waiting, and he had the gabapentin and the OxyContin and the oxycodone all together like 3 days early. As I said, I'm expecting a grandbaby in September, and I can't let this fall behind.
No.
Yeah. Prescribe it out there. You can't do that. So I can have it filled September 15th, I think, and then we can leave after that.
I know. I always have to work around travel, or if we're going to be out of town, like, will I be able to get it before we leave? And
such a bad, like, there should be so many articles about this part of it instead of it's always about the people that are, having problems, which are a lot of times they're other people's drugs, they're street drugs, or they're stealing the drugs. And the people that need them, there's not enough, nobody's writing about them. Just, I don't know. You see the blogs now and then, and if they're not well written, they get tossed out. Nobody's interested. And I don't know. The whole thing is backwards. It just is terrible. It really is. Sorry to make it sound like that, but
it is.
Anxiety, you hit on the nerve of the anxiety, which.
Yeah, I hate the anxiety about that. I wish
making a phone call and just making
especially when you've been on the medicine for forever. Like we haven't changed. This is never going to go away. So why are you only allowing me to renew it with my insurance every year? Like renew it for 5 years and take the stress out of making sure the doctor has the forms filled out and sent to the insurance and all that crap. Crazy.
It's really bad. It's really bad. It's not fair.
So I have
it's not fair about like, where do we count? Like,
the ones that are taking it responsibly.
Right.
Yeah. That's why I wish I didn't need it at all.
Of course. It's just hard. Of course.
Yeah, I think you told me that how many times.
Yeah.
And to put you in a headlock.
You had to really push me hard to even consider.
Yeah.
How old were you, Donna, when you were diagnosed?
I was 42, I believe.
She doesn't look her age this way. You can't
42.
Tell. She looks like 22 still.
Right.
How do you do that?
Gotta be genes.
Yeah.
And now I'm 51.
Yeah.
Wow.
You're still a baby.
Yeah, exactly. That's right, Amy.
But I have a long way to go with these meds.
That's how I felt. Exactly. I think I was 51 when I started it, and I'm 63 now, and I just can't believe how much time it took of my life, and the different things that you could have done, I could have done and didn't do. But it's.
I often wonder where I would be with my career.
Yeah, same thing.
Yeah.
And look at the past, girl. Got beautiful kids and husband and everything else. Got to talk to positive, right, Don?
Yeah.
Sorry, I'm bad. I'm sorry.
No, it's normal.
No, it's
reality. Everybody, you're the first people I've spoken to. It's really amazing.
That's what we find when we've been in the conference room. Lynn used to drive an hour by herself, and then Pete drove her to come all the way over to Beaumont. It was only 3 or 4 miles from me, but Lynn had to come all the way across town, and 20 plus years she rarely missed a meeting.
Wow, that's really nice. That's incredible.
Yeah, Tim's been
I believe you.
Tim is such a godson for so many people.
I won't tell you how I talked her into being my co-leader. It's our secret.
It's such a commitment. It's really nice. It's incredible.
Yeah.
And someone else did.
It's a family. I'm glad you're part of it, Amy. Come back anytime.
Thank you.
Yeah.
And if you
want
want
my list now.
What?
I sent
on the list.
Yeah.
Am I on this list? Am I on? I'll be on the list for this meeting, right?
What's your email again? I don't have them in front of me.
AGEE5.
Yeah, I put that on.
At AOL.
Yeah. AG5. Yeah.
You made it nice and simple.
I think Lynn gave me that, didn't you, Lynn?
Yep.
Yeah, you gave it to me. Yeah.
I didn't. So, are you a member of the Facial Pain Association then, or not?
So it's funny when that trip we were going to make out to San Diego, which was almost 2 years. I guess it was 2 years ago almost. I started getting the magazine recently, like just now, the last couple of months, I think, and nothing happened in between, and now I started getting it.
Huh.
So do you give them a small amount?
No, but I will now that I just started getting them in the magazine again. It's weird how that just showed up the last couple of
They
months.
had told me a while ago, it's a new regime running it the last year or two, but what they had told me prior was if you made any kind of contribution each year, then they kept you on the distribution.
Okay, I think because I ended up not going to that conference, and I felt everything again was so regular, trigeminal neuralgia focused. I stopped looking at I just never looked again. And then the other night, I was Googling and this showed up. So I said, let me see what's going on again. So
we've had a few people over the years would come to one meeting and they say, I don't want to come again because I don't want to talk about it. But for the most part, meeting in the conference room, people continue to come because most of them would say, this is the first time I ever talked to anybody else that knew, including doctors even,
Right.
Some doctors they couldn't find that knew how to treat it.
I've talked to doctors and I had a GP like you were explaining for 30 years. Thank God he did get COVID and survived it. I don't know how much longer he'll want to work though. He should retire. He's a great man. And he's the one who hooked me up with the pain management doctor who ended up passing away 7 years ago, like a year after I started with him.
He had his nerve.
Bad luck. But he believed I had to, don't pull any more teeth and get to
Right.
Well, I'm hoping Pete will keep this up. We'll have to decide, Lynn, after we get through the pandemic. The only thing people are missing is your hugs.
And yours too. Well, I think
we keep doing it virtually or go back to home.
I think it's a lot easier for people to do it on Zoom.
Yeah, if people are willing to do it
without the weather. Our only trick will be September will be good, but October we might have to Zoom from there with a screaming infant in the background.
That's
but
good.
we'll make it work.
It's great.
Yeah. I'll put us on mute, but we'll still make it work.
Hey, I brought Natalie when she was little. You can bring your grandchild to the Zoom meetings.
There you go. Both of us. Amy, I expect to see yours too then, right? Oh, that's so exciting.
Yeah.
Well, please keep us posted.
Yeah, thank you. I will. Thank you.
Exciting.
Yeah, you're just 2 months after that. So
that's wild. So wild.
Thanks, Donna, for coming back. It's great to have people who have gone through the trials. I still think there's maybe a role for you to play with Rachel because she's in a very similar situation to you, Donna.
Yeah.
Yeah, I really appreciate it.
I don't want to put a burden on you, but
no,
it's worthwhile connecting with her and see if there's something else you can talk to her about.
That was so sad. She really, oh my gosh.
Is she in Michigan or?
No, she's in, I wrote it down from.
She's in New York.
Clarence, New York.
And that other gal that we had, Artie, that was talking about her sinuses, she's a pediatrician. And she can hardly work.
Ann Arbor, right, Lynn?
Yeah, she can hardly work. She's just doing telehealth. She has 2 little kids. It's like you just want to,
Yeah. I have no problem being there for anybody that is going through this, Tim. So definitely send out my name or email or phone number or whatever.
Willing to talk to people. Yeah.
Yeah.
That's so nice. It's really nice. Thank you, Donna, for giving me the information too. Thank you, everybody. It's amazing.
Donna, did you ever go for a walk with that woman that was here a couple meetings ago? That was near you?
No, I sent her my phone number to text me, but I haven't heard from her.
That was nice.
But it definitely helps when I go into nature and I walk.
Doesn't it?
it really lifts me a lot.
Yeah, those endorphins, it really works.
And the Paint Creek Trail that we have right down the road, I mean, I would pick her up and take her with me to walk if she's able to walk.
Yeah.
Because she's right down the road from me, and that trail is beautiful.
Yeah. What was her name again? I forgot already.
No, I forgot. What, the one with the glasses? The round glasses.
Oh, Melody. Melody.
Yeah.
Yeah. Nice. Well, thank you guys so much for joining us. We're going to go have a late dinner and probably some trash TV.
Yeah. All right. Thank you. Thank you, Peter.
Love you guys. Thanks for coming.
Thank you, Tim. Thank you so much. Thank you, Lynn. Everybody, Donna.
Stay in touch. You have my email now, Amy.
Okay. Thank you, Donna. You too.
We had Casey go 3 hours once, and I have two discs. I could put 2 hours on one and an hour on the other.
Is everything on YouTube? You have it all on YouTube?
Yeah. Well, Casey, yeah.
I don't know that it's smart, though, that we talk about specific people being on opiates because they could track us down. And I
can delete that. I'll just leave mine on.
I think so too.
I'm kind of creeped out about that because I
am too.
Do you worry about that? I worry like people are going to fall over the phone.
I think so too. Yeah.
I'll delete both of yours when I look at the tape then.
Okay.
But I'll leave mine on because mine's been out there forever.
Yeah, and you don't take
They were going to hit me. They would have hit me long ago.
I think if you can get mine off too, I kind of held back a little, so
yeah,
it's nerve-wracking.
All right.
It's nice to know that you could, be comfortable and let us know what to.
Yeah, I'll delete that stuff. Yeah.
Yeah, no, I'm glad we can talk about it though because
exactly.
It really helps. That's what we're all like need.
Right.
Yeah.
And one of the things I forgot, Pete, we always started our meeting at Beaumont by saying, I'm taping this, but know that we put it on YouTube. And then I would shut the camera off if somebody, I'm not asking you to do that. That's the tough part for you. Just let it run and then leave it up to me to delete the things that I think shouldn't be on there.
You have to go, wow.
Especially when they tell me it like this.
Yeah, I'm sorry. I didn't realize that.
No, that's fine.
I can do whatever you want. It just
we can watching it again though. That's like
you can't do it during the meeting. But just let it roll. It's good for people to be open.
Yeah,
and I'll delete it when I scrub.
Yeah, a lot of times some of it has just been the presenter, but when it's a Q&A, it's kind of different. Like it's not a whole. It was more you share more.
Sometimes the Q&A is more important to people that are new, Lynn.
Oh, absolutely.
And the talk. So
no, I agree. I like Dr. Rossi was great.
Yeah, I got to ask the doctor questions, and I got to ask questions. I mean, yeah.
Good. And she was very good with the meds.
If you've got a question of Dr. Rossi, send it to me, and I'll send it to her, and then I won't send you her message, but I'll take her email off it because I don't know if she wants it out there. It's up to her to give it out.
Right, of course.
If you've got a question up, or just send it to me.
Thank you.
And I'll pass it on.
Thank you.
All right. Very good, guys. You're going to have a good night. What's left of it?
And Pete and Lynn.
Take good care of yourselves.
Good night, everybody.
Thank you.
Bye.
Bye.
Bye.